Hello, 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 my friends. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. I am the National IC Support Group leader. It is Sunday, November 15th, and it is time for another IC Support Group meeting for anybody who might be struggling because, seriously, this is crazy. I mean, the stress level we are under right now is ridiculous, but working together, we are going to get through it. I promise you that we will get through this. Hello, Barbara. It's nice to see you. All right. Now we are live streaming on Facebook and YouTube. So give me one quick moment here. Where did my Facebook window go? Where are you, Facebook? Where'd you go? Hello, Nicole. It's nice to see you. Okay. No, I don't want to listen to Apple Podcasts. Oh, for God's sake. No, stop it. I don't want to listen to you right now. All right. Where'd my Facebook feed go? Hello, Shirley. Did I lose my Facebook feed? Apparently I did. Well, let's try that again then, shall we? Give me one quick moment and let's just set this up again. So I hope y'all slept well last night. Man, I did not sleep well the night before. I was dragging all day yesterday. And I had this surreal dream where I had decided to go back to school, become a urology nurse. Of course, it's like, why not be a doctor? You know, I do have a pre-med degree, and the reason why I didn't do that. Oh, wait, no. Okay, so we are live on Facebook. That is so weird. I don't know what happened to my screen. Give me a moment here. Do not quite understand what's going on here. Hi, Carolyn. Hi, Philippa. Hi, Julianne. You guys bear with me here. I'm just trying to, my computer is being a little bit weird. You're going to hear me. Give me a moment here. Do not quite understand what's going on here. Facebook, I'm confused. My window says you're closed. Oh, wait. Okay. No, it says now I'm watching a live. Bear with me here. I'm just trying to. Oh, wait. Now it says I'm watching my own video. Hold on a sec. This is hysterical. Okay, sorry. You can hear that. All right. All right, Facebook, hun. This is baffling. Absolutely baffling. Hi, Donna. Hi, Natalie. Thank you. I am doing great. And fire season is over, baby. We had rain for 24 hours. Fire season is over. All right. So I have got, you guys, I apologize. Give me one quick second. Facebook is, we do live stream, and I have lost my Facebook feed. So give me one moment. Come on, Facebook. Oh, wait, there you are. Yes, I found you. Now listen, it's not going to be a real Jill Osborne IC support group meeting if something doesn't, or we have an earthquake or whatever. All right, so now I've got Facebook back. Hello, Facebook. Hello, Caroline. Hello, Julianne. Hello, Philippa. Philippa says, thank you again for your great advice about bladder rest. I ordered it. Well, it'd be interesting to see how you do with it. That's for sure. Kathy. Oh, good. Carolyn says all live feeds are up. Okay. So you guys, so let me introduce myself. My name is Jill Osborne. I'm the president and founder of the Interstitial Cystitis Network. I'm the longest serving IC support group leader in the United States. And I think very close to being in the world now. I think the German group, I don't know if they're still doing meetings or not, but I'm here because I love you, and I believe that working together, we are going to make a difference. And by working together, we can help each other tremendously. I bring to you 3 college degrees. I have a degree in chemistry, I have a degree in pharmacology, drug development. That means I did a year's worth of surgery. Um, so I know my way around the body just a bit, but I didn't like that career. And so I went back into psychology. I got a master's degree in psychology. I had a presidential fellowship from the first President, George Bush. And yes, that long ago. And ironically, the IC Network, my website, icnetwork.org, was my doctoral dissertation proposal, which I could not do because it hurt too much to drive to school. But anyway, I'm very happy that 27, well, more than that, years later, my doctoral dissertation proposal has been ranked yet again #1 in the world by Harvard Medical School and the University of London. When you come to one of my support group meetings, it's very important that you understand that you're getting really top tier information that you're going to see at the top research level. The question is your local doctor going to know about it? And the answer is probably not. And so we are in the position of being educators. And frankly, that's what we need. And I want to talk to you about something, but here, hold on a second. Let me fix this. That's going to drive me crazy if I don't fix that. All right. So I want to go, I want to introduce something that I think is really, really, really important. And that is the perception that interstitial cystitis is a mental disorder or a psychiatric disorder. And I want to, I was talking with a friend on Friday who, like many other patients, when she was first diagnosed, was referred to psychiatry. My very first appointment, my urologist, even though I had a chemical burn in my bladder, and that's what I was diagnosed with, one of the very first things my doctor said is, maybe you need to go see a psychologist. It's like, no, I don't need to go see a psychologist. Don't tell me what the fuck to do. Oh, excuse me. I apologize for swearing, but you're going to get that in a moment. I apologize. Oh my God, I'm better than that. But this is why I'm angry, is because I have worked with patients who have been committed to psych hospitals. I have worked with patients who have been strapped down to gurneys in ambulances for hours and not allowed to use the restroom. I have worked with patients. I had one patient I worked with. She was bleeding from her bladder, and her family disowned her, including her doctor father. And she was freaking bleeding. Like, are you serious? Are you serious? I had one patient that I worked with who, in addition to being strapped down to a gurney in a hospital, she had a 4 or 5 hour ride to a mental hospital. She gets to the mental hospital and she's bawling her eyes out, begging to use a restroom. And they wouldn't let her at first. And finally they did, but they had to have the door open and somebody be in there with her because they thought that she was psychiatric. And in 95% of those cases, these patients usually receive a profuse apology from the psychiatrist that somebody had the audacity to suggest that their pain was all in their heads. A mental and emotional issue is not interstitial cystitis. Interstitial cystitis is, in fact, for some of you, a viral infection in the bladder. For some of you, it could be a fungal infection in the bladder. For a lot of you, you could have a history of pelvic trauma, falling on your tailbone, and things like that. The care that patients have received in the years past have been nothing short of disgraceful. And it goes back to the 1950s. So remember, IC was first discussed in a medical journal back in like 1860 in England. And if you read that definition, it's perfect today. Patient frequency, urgency, pressure, pain, in the absence of an obvious cause, right? And we knew in the 1920s when Dr. Guy Hunter invented this or used the cystoscope. I don't know if he invented it, but he was the first to see Hunter's lesions. That's why they're called Hunter's lesions. We knew in the 40s during World War II that this could happen to children. We knew certainly that this could happen to men. But in the 1950s, two absolute pricks of doctors published a case study of a young patient in which they claimed that this person had unexpressed anger manifested in the pelvis. And from that moment until literally 1980, medical schools taught that IC was an emotional condition, a psychiatric condition. And that's why when you go to older doctors, some doctors look at you as, oh God, here's an IC patient. That's why I always say when you go to a doctor, please don't walk in and say you have IC, because we don't want you to fall down the rabbit hole of old beliefs about IC. There's no doubt that this is a real condition. The US government has put $100 million into studying this. They wouldn't do this if this was not a real condition. But the legacy of that still haunts us today to a certain point. And on Twitter this morning, somebody was talking about, they asked, well, how were patients with pelvic pain treated 30 years ago? And the answer is some of them were given electroshock therapy or worse. And this is why we have to work together to educate, to inform, to be proactive, to leave such a good impression with your doctor that they will welcome the next IC patient. What you do will affect other people visiting that doctor. And it's kind of, the whole doctor-patient relation thing is really challenging. I mean, obviously, if you've got a doctor who is treating you with disrespect, who is refusing to give you therapies, who's telling you that there's no hope, who's telling you there's nothing else that they can do for you, and or worse, if you have a doctor who says, hey, man, I think you just like being in pain, we need to send you over to psychiatry, obviously, you're going to go to somebody else. You deserve better treatment than that. But if you're working with a doctor who is passionate about helping you, even if they don't know a lot about IC, then I need you to be kind. I need you to build a relationship. I need you to be our advocate so that the next patient that comes along is not treated poorly. So Dr. Dan Brookhoff. Dan Brookhoff is a legend in the IC world. He's no longer with us, unfortunately. He passed away several years ago. His story was very interesting because he was a pain specialist. And his specialty was, like, I think, end-of-life pain. And he was caring for a woman who was dying, and her sister was there. And her sister said, I wish you could help me. And Dr. Brookhoff said, well, do you have cancer? And she said, no, I have interstitial cystitis. And Dan said, well, I can't help you. You're not dying. And the patient said, but I feel like that would be better. And that really caught Dan's attention. And it was from that moment that he dedicated a huge portion of his career. He was at the University of Tennessee, I think in Memphis, well, I forget the exact name of the clinic he was at. And he came out to California. He was my keynote speaker at a California pain conference that I chaired. And I asked him to come out and speak. And he said the worst thing a doctor can do is take your hope away. If a doctor takes your hope away, that's definitely not the doctor that needs to be with you. There is so much hope in the IC world now. We're so good at subtyping. We're so good at figuring out all the little weird things that can trigger all of these symptoms. I mean, you have every reason to be hopeful. But when he was in medical school, this is what he was taught. So he became an internal medicine specialist, right? They did 1 day of urology training, and they had a very famous doctor who did that training for them. And literally at the end of the day, the doctor was closing up his books and said, oh, there's one more thing I need to tell you about. It's a disease called interstitial cystitis. And these are going to be the hardest patients, the worst patients you're ever going to work with. All they're ever going to do is call you and ask for pain meds. and they're all psychiatric, right? I mean, that was basically what he was told. And one of the residents said, "Well, how do you treat it?" And the doctor said, "We remove their bladder." And the resident said, "But if it's all in their head, why on earth would you remove their bladder?" And that really put that speaker on the spot, because at that point in time, that speaker basically scuttled out of the room. It's not all in your head. It's real. It's treatable, but you are an anatomical mystery to be solved. We have got to figure out what is driving your symptoms, because it's not always the bladder. There are structures outside of the pelvis, the nerves, the muscles, and how they relate to each other, and how the bladder relates to the bowel, and the spinal cord can be involved, and Tarlov cysts can be involved, and fibroid tumors can be involved, and pelvic congestion syndrome can be involved. We're doing so good now at figuring out those of you who are not responding to bladder therapies. If you're not responding to bladder therapies, it usually means that maybe, especially if you've got a normal bladder like me, hey man, if you have a hydrodistension cystoscopy and they say your bladder's normal, take that for what it is. That's good news. We'll take that. But now we've got to look outside the bladder and figure out what's going on outside of the bladder. At my last meeting, I talked about some of the new research that came out from the International Pelvic Pain Society meeting. And I've just added a couple of new sections on our website last night on something called chronic overlapping pain conditions. So we know when we work with patients, if you've spent any time with patients, there is a huge group of patients who have IC, IBS, vulvodynia, super sensitive skin, TMJ, migraines, eye pain, fibromyalgia. Did I say fibromyalgia? Right. Okay. I'm in that group. I had frequency urgency in 7th grade. I had vulvodynia in high school. I had IBS in my 20s. I got IC in my 30s. And all the sensitivity started in my 20s too. So what the hell is that? What is that? Now, remember, 20, 30 years ago, we assumed it was all bladder disease. But now we know that that actually is a central nervous system injury. Well, there can be heredity. Like there's heredity in my family. So if you've got super sensitive skin, if you are super sensitive to medications, super sensitive to foods, if you have a wicked sense of smell and you can smell things that other people cannot smell. Now let's think about that. Smelling is a brain function. Our brains are involved with what? Yeah, our brains are involved. And in fact, back in the 1990s, there was researchers at UC Berkeley who were trying to figure out why so many IC patients had a wicked sense of smell. Now we know why. Because the condition is called a chronic overlapping pain condition. And there has been Kathy's asking about pelvic congestion syndrome. Yes, I did a whole big article on that. Hold tight. Let me finish this and we'll talk about that. The Chronic Pain Research Alliance has been working on this aggressively for like the last 15 years, and it's being led by the TMJ Association, which is fabulous. This group, the research coming out of this group is astonishing. And it's also matching the research from the MAP Research Network, the Multidisciplinary Approach for the Study of Pelvic Pain from the National Institutes of Health. So some of you have heard about brain scans. Why would you scan my brain if it's a bladder issue? Well, it turns out when you have chronic overlapping pain conditions, it's different. It's more sensitive. It's easier to turn on. And again, for some of us, it's inherited, like me. Hello, redhead, Norway. But for us, after trauma. And in fact, one of the classes I took was the class on pediatric risk factors for chronic pelvic pain. And in many cases, it goes back to a trauma. Did you fall on your freaking tailbone like I did when I was in elementary school and I broke the tip of my tailbone off? That may have been the triggering event. That when you sustain an injury, not only are bones broken, and not only are muscles stressed, and of course bruising happens, so we know blood vessels get broken when you fall. But what happens to the nerves when you're injured? They become more sensitive. They become easier to turn on. So you take somebody who didn't have an injury, who doesn't have chronic sensitization, you could put 500 cc's of fluid in their bladder, they can walk around for hours. You put 50 cc's of urine in my bladder or fluid in my bladder, I'm going to feel it. Might not hurt, but the odds are I'm going to be going to the bathroom probably within 20 minutes. Why? My bladder's healthy. You look at my bladder, there's not a problem with my bladder. It's my nervous system. My nervous system is easier to turn on. And they can see that in brain scans. They can see that different parts of the brain are communicating differently in people who have this. And it's not terrible in any way, shape, or form. It's potentially fixable. And so nobody's saying, and I'm not saying to you that this is a mental disease, a mental illness, because it's not. What it is, though, for some of us is a nervous system dysfunction. And we have to retrain our nerves. We have to gain control of our body again. And I want to let me just I want to say this here. Now, listen. Now, y'all know I work with patients every single day, even on my days off. If you call, the odds are I'll probably answer the phone. I've even answered the phone at 1 a.m. I have a little angel that says, "Pick up this phone. Somebody needs you," and I usually do that. Some of the patients I work with are spinning in a circle of anxiety. Man, you cannot stop yourself. It is like I say, "Have you tried this?" And you're like, "Yes, nothing's worked." Okay. "Have you done this?" "Yes, nothing's worked. Tell me what's going to work." And it's like, wait a second. "Have you been to a doctor?" "No, they all hate me. I won't work with that doctor." Okay, wait a second. Now, hold on a second. Let's breathe for a moment. "Have you made any appointments?" "No, they'll all hate me." Okay. This person is stuck in this massive cyclone of anxiety. And anxiety is a chemical reaction for a lot of us. Man, the more anxious you are, you're having a ton of fight or flight. You're having a ton of adrenaline going through your bloodstream. What is that doing? That is triggering your nervous system. Pain that is accompanied by anxiety will be magnified by the midbrain. Pain that is accompanied by laughter will be minimized. The more anxious you are, the worse your pain will be, period. Because that's fight or flight. Remember, our bodies were not designed for life today. Our bodies were designed for life thousands of years ago. They didn't have the stress of the internet, the stress of elections, the stress of the media. Man, all they were dealing with was running from saber-tooth tigers and finding food. We live 24 hours of stress right now. What is the content? What does that do to our bodies? It winds us up. The nervous system gets wound up. The nervous system is easier to trigger. And you're going to be in a hell of a lot more pain if you have uncontrolled anxiety. And so the foundation of every good pain management program, the first thing they're going to work on is your anxiety. Because we got to calm everything down. And then we've got to retrain these nerves. And the thing is that the research proves it works. Mindfulness, progressive relaxation. This is about reteaching your brain how to react to stress, how to react to trauma. Your nervous system got triggered. We have to now untrigger it. We have got to calm it down. And so this is the context of mind-body medicine. And again, the research behind it's stunning. It's so, so good. And I often wonder, it's like, I'm a super optimistic person. For those of you who know me, I mean, hello, my magazine is called The Icy Optimist. And yet I had tons of catastrophizing in my 20s when this all hit. It was like I'm damaged goods. Nobody would love me. Nobody would care for me. Oh God, when you're in pain and all that triggers, it just winds you up. Just winds up and you start spinning and spinning and spinning and you cannot stop yourself even if you wanted to. And then one day, after yet another panic attack, as I was getting ready to go to a doctor, I was sitting out in my backyard, same house I'm in now, and I was crying, going, I can't do this anymore. I don't want to live this way anymore. Why am I having a panic attack when I'm thinking about going to the doctor? And I signed up for a class and it changed my life. And I have not had a panic attack since I took that class. But the other thing that happened is that my pain went down. My nervous system calmed down. And today, I live pain-free most of the time. My bladder doesn't hurt. My vulva doesn't hurt. Why? Because my bladder was, even though, yes, I had a bladder injury, the dominant portion of my IC was chronic overlapping pain conditions. My nervous system is remarkably sensitive, and it still is today. I mean, I still have sensitive skin. Okay, but I'm not winding it up. I'm winding it down. That is my job on a daily basis, is to calm and soothe my nervous system when I have subtype 5 central sensitization. Kathy says, my daughter's spinning desperately. Can you talk to her? Yeah, absolutely. I would love to talk with your doctor. And my phone number is right on our website, IC Network, icnetwork.org. Just go on over there. So while, again, I began this discussion by saying that this is not a mental or emotional or psychiatric condition. It's not IC, chronic pelvic pain. We don't consider a mental disease. Obviously, some of you have Hunner's lesions, some of you have viral infections, et cetera, et cetera. And some of us have a damaged nervous system. And we have to retrain our nerves to react correctly in times of stress. And when you look at the American Urology Association guidelines for IC, in step 1, they say relaxation, they say acupuncture. And guess what? That's what that does. That helps to calm the nervous system down. So anyway, I just want to do that. Wanted to just plant that seed, my friends. And you can come on over to our website and read some of the things that I did. Somebody asked, what class did I take? I took a class called Phobease, Phobease. And I don't know if they do it right now. Boreas says it's hurting like crazy, burning inside right now. Borea, where is it burning? Is it burning in your urethra, your vagina, or your bladder? Lauren says anxiety has a direct effect on the bladder because it is made of smooth muscle. The only organ made of smooth muscle, the only other organ is the heart. Both respond to stress and anxiety. These emotions can trigger the bladder. It's a physical thing, 100%. So Kathy, our phone number is 1-800-928-7496. Pelvic congestion syndrome. So remember, you are an anatomical mystery to be solved. Today, we no longer consider IC an incurable bladder disease. We consider it a pelvic pain syndrome. And it is our job to try to rule out the many, many things that can be triggering your bladder. Sometimes your bladder is a secondary victim of another issue. One of the things that we consistently see now is pelvic congestion syndrome. Pelvic congestion syndrome is basically varicose veins in your pelvis. So if as the day goes on, your pelvis gets heavier and heavier until finally you feel like you're carrying a bowling ball around in your pelvis, that is usually pelvic congestion syndrome. And that's very, very fixable. But you have to see an interventional radiologist to do that. And I covered it in our magazine, our summer magazine. Amanda says, I fell on my tailbone when I was 14, fractured my pelvis when I was 19, got diagnosed with stage 4 endometriosis when I was 23. You had many procedures to get rid of the endo. You got an endometrial ablation in 2017, then a hysterectomy due to the failed ablation. Oh, honey, I'm so sorry. Got diagnosed with adenomyosis, and then a month after that, we're diagnosed with IC. I feel the NovaSure ablation caused a lot of trauma. Should never have had that. Honey, I don't think that, listen, you guys, y'all understand here that I cannot give you medical advice. My job is to plant seeds and kick you in the tush and get you back to your doctor to talk about maybe some of the points that I might raise here to help you find the answers. Amanda, it's far more likely that the tailbone injury and the fractured pelvis is what created the foundation for this. I don't believe that the ablation would do it at all. I think instead, understand that when you fall on your tailbone, you suffer a compression injury. So the muscles are compressed. If your bone was broken, your bone was compressed, but the blood vessels are compressed. And compressed blood vessels are bad. So what happens is when you suffer an injury like that, you have, you know what? Let me just get a picture. Hold on. Hold on a sec. Hold on. Just hold on. Let me see if I can find this picture. So think about it this way. Let's say you fell on your butt. So you fall on, let's say, a 5-inch square area of your butt. And let's just say you weigh 150 pounds. So 150 pounds have now landed in a small area, let's just say on your butt. So we know that 150 pounds are now squeezing the muscles, right? So that's a compression injury. Okay. We also know that compression is squeezing blood vessels, right? And if you get a bruise, that proves that the compression was so severe it actually ruptured the blood vessel. But what about the nerves? What about the nerves? The nerves have also been compressed, and more importantly, the blood vessels which support those nerves have been compressed. What you may not know is that a nerve cannot be healthy if it does not have good blood supply. When that nerve fires, it releases a chemical into the bloodstream that is immediately reabsorbed. And if it doesn't have good blood supply, that nerve is now damaged. And eventually that nerve damage is going to spread. It's going to start at that localized area right in your butt cheek, but then the odds are it's probably going to get up towards the spinal cord fairly quickly. And then the nerves that support the bladder will also become somewhat diseased. And not diseased is the wrong word, damaged nerves release a substance called substance P, which damages tissue. I kind of want to, this is not quite the right explanation, but think about shingles. When somebody has shingles, they have an active viral infection in their skin and it turns red. Well, that's kind of what happens with nerve damage. When the nerves release something called substance P, it also causes localized inflammation. And that's why the bladder gets involved. Now, the other thing that happens is that the area that you fell on, that muscle is now weak. And the odds are, because of the damage, it has developed a trigger point. Look, these are muscles. So this is a good picture, right? So here are muscle fibers. You can see the muscles that support the muscle fibers. Let's see, did I get that right? Yeah, okay. Here we go. So these are the healthy blood vessels which support the muscles, right? And now look, here's a muscle knot. A muscle knot, which often happens after injury, you might not know it's there. It might be a latent muscle knot, but it's there. And as long as there's a muscle knot there, this muscle will not be healthy because it's stuck. Muscles normally, just to kind of give you a clue, your muscle fibers are kind of horizontal, and when you do this, when you tighten a muscle, the fibers slide like this, and then when you release the muscle, the fibers slide back apart. A muscle knot it gets stuck like this, right? They get stuck. It doesn't release. So here it is. Here's a muscle fiber. in the pelvic floor that is now stuck. And look at what it's doing to the blood vessel. It's causing a long-term um, ischemia, ischemia, right? So now we've got long-term blood supply issues, and now we have long-term muscle issues. And so, Amanda, honestly, I really think that it was the fall on your tailbone and what that did to your muscles, along with your fractured pelvis, that is driving your symptoms. I really don't think it has anything to do with the ablation at all. Other than the fact that an ablation, listen, you had endometriosis. Endometriosis hurts like hell. Your muscles are going to get tight to protect you from that pain. So there's no doubt you have pelvic floor dysfunction from the endometriosis. And if the ablation was exquisitely painful, then yes, too, you would have muscle tension from that. But I bet the foundation for all of this was laid first with you falling on your tailbone. It's astonishing the number of you who have tailbone injuries, and I'm one of them. Like I said, I remember breaking the tip of my tailbone off, and I could move it with my finger for about a year. I could. I used to do it. I mean, not that I enjoyed doing that, but as a kid, I absolutely could move it. So that's one thing we're going to look at. But we're going to look at, again, endometriosis. That could be on the bladder. It could be on the outside of the bladder, working its way in. We're going to look at fibroid tumors. We're going to look at your hips, make sure there's nothing. We just had a new research study that showed that 70% of men with testicular pain had an underlying orthopedic hip dysfunction. Go figure. No, we know now that bones and muscles can trigger pain in the bladder and in the testicles and in the prostate. Lauren says, my psychiatrist was an anxiety specialist and always got referrals for urology. Hey, man, I'm all about working on those skills. You know, you weren't born with the skills to deal with IC and deal with life today. We weren't born with those skills. We have to learn those skills. And when you go see an anxiety specialist or you go take a class, it's skill building. This is not about you sitting down and talking about whatever the heck happened to you when you were a kid. This is about, doctor, how can I approach a doctor's appointment today without having a panic attack? What can I do? And one of the things that really helped me, because I was stuck in that spinning cycle of anxiety, is I did creative visualization. So instead of assuming the worst, it's like, okay, I'm going to go to the doctor and he's going to dilate my urethra and it's going to hurt like hell and I'm going to be in pain for days afterwards. Hello, catastrophizing at worst. What I started to do instead was rehearse a perfect appointment. Rehearse how I want that appointment to go. Okay, I'm gonna feel good that morning. I'm gonna wash my hair. I'm gonna dress. I'm like optimistic. I'm gonna drive there. No problems in the car. We get there. The receptionist has a giant smile on her face. Hi, Jill. How you doing? I'm great. You get it, and they call you back, and the nurse is really friendly and kind and supportive and caring. And then the doctor comes in and it's like, Jill, I can explain exactly why your urethra hurts. It's because you have estrogen atrophy. And I gave you the cream a year ago. Didn't you use it? And I'm like, no. Because why? And I go, because in my brain, I'm 25 years old and I couldn't possibly have an age-related issue. And he goes, you do? And here in my brain, you're thinking cancer, you're thinking all this sort of stuff. And it's like, Jill, it's nothing to worry about. Positive visualization. I rehearsed the best appointment on my brain before I went. And, I'm telling you, that was one of many coping skills that you can do. Donna says, you just flip the script. Donna says, I hurt my foot. I think that triggered my IC. I did not want anything to touch my foot. I did not have feeling on the top of my foot. It's better now. However, I still have issues with numbness. And so, yeah, Donna, that is an example of a trauma that is going to sensitize your entire central nervous system. Throw in the fact that it's your foot and it's going to mess with how you're walking, which is then going to directly influence your pelvic floor, which is potentially going to cause long-term chronic pelvic floor tension. So we got two things going on. We have a potential nerve sensitivity from that injury combined with now what we call a mechanical injury, where the pelvic floor muscles are being affected by something else, such as a bad hip. Hey, man, look at this. Oh, okay. Not to show you my muffin top. Can you see this? You see this right here? That is my SI belt because I have an SI issue. And when I put it on, I feel better. So I put it on. But that is a mechanical injury. I don't have my bladder's healthy. My muscles are chronically tight on my left side because of my SI joint. That is a source now of any pain that I have in my pelvis. Kind of rambling here. Sorry about that. Lawrence says, glad to see you. This is the best place to be. I'm in remission. Yeah, baby. I love it. Excellent. I'm so happy for you. Oh, that was Deborah. Okay, Angela says, I think I may be gluten intolerant as I can't have any types of sweets or jams because anything sweet causes the most flares. Actually, Angela, what I would do, I would have a test for Candida. About 5 years ago, our own National Institutes of Health IC researchers discovered that many patients were flaring because they had an overgrowth of fungus in their urine, Candida in their urine. And think about if you ever make yeast bread, what do? You prepare the yeast by putting dried yeast into warm water with a little bit of sugar. And what does it do? It starts to bubble and grow. We have that same type of yeast in our body. And if you're flaring when you're eating sugar, that kind of implies that you might have a fungal infection. And so having a next generation urine test would be a very, very good thing to do because that will tell us if you do have a fungal infection. Let me get my slides here for a moment. So you can go to, built a website on this, bladderhealth.org, bladderhealth.org. Here you go. And you can watch doctors who film videos who use this now. This is the next generation of testing. That's why it's called next generation. It's much more thorough than a typical urine test. And we had a keynote lecture at the American Urology Association meeting this year in which they predicted very quickly that this would replace typical urine cultures. Urine cultures will only test for certain bacteria. And if there's any patient who's going to be at risk of fungal infection, it's us because we have been so incredibly overexposed to antibiotics. And when you take an antibiotic, it kills the bacteria that normally eat fungus and controls fungus. That's why we don't want you to self-medicate with antibiotics because you're creating a good foundation for fungal infection to happen. So that would be something that you could rule out, Angela. Boreas says, inside the bladder, it burns like crazy all the time. I take Azo and drink tons of water. Borea, I can't tell how old you are. So one of the very first things, okay, let's think about this for a moment. If you have pain as your bladder fills with urine, that is relieved by urination. So the fuller you get, the worse you feel. Man, we're talking agony, right? But then as soon as you empty your bladder, your pain improves, if not goes away, maybe just for 5 or 10 minutes, but it improves dramatically. That tells us that your bladder wall is irritated and or damaged. So look at it this way. So this is a picture of what we call petechial hemorrhages. So they're wounds. And of course, we don't think that these are really as relevant as we used to, but this is a good example. So imagine your bladder's filling with urine, fuller. Urine is now getting into these areas of injury, hurt. And then when you pee, it empties. Urine is no longer touching the wound. That is a sign that your bladder wall is driving your symptom. If you have burning after you're done peeing, not before, but afterwards, we're looking at muscle. So let's talk about the bladder wall for a moment. The bladder wall, we're going to look first at estrogen atrophy. If you've had a hysterectomy, if you're perimenopausal or postmenopausal, we know that the bladder lining gets thinner and thinner and thinner, which makes it much more vulnerable to chemical irritation. So it surprises women that in your 30s and 40s, you can get away with a couple cups of coffee a day. And then all of a sudden in your 50s, bam, you have pain when you have 1 cup of coffee. That's not a disease process for many of you. That is just simply estrogen atrophy. If your vulva is dry and your vagina is dry, so is your urethra and so is your bladder. So concept number one, Boria, is your skin dry? And concept number two is, if it's dry, are you irritating it daily with something that you don't know is hurting you? So number one, again, your bladder can't defend itself from coffee. So you got to lose the coffee, you got to lose the soda, you got to lose the artificial sugar, you got to lose the lemonade, you got to lose the limeade, sweet tea, all that sort of stuff. That's all got to go. But also look at, are you taking a multivitamin? Multivitamins are notorious for irritating the bladder really, really badly. God forbid you're taking a multivitamin every day, like a Centrum or a one a day. Girl, that's going to hurt, and that's going to be a lot of long-term pain as long as that bladder is being irritated. Okay, so look at what you're doing every day. And something as simple as using a water filter. Some water filters take out too much. And they take out the chemicals which normally pH balance the water or the minerals. And so what happens is you end up with acid water. You might be drinking acid water all day. So we don't recommend Brita water filters because one patient was able to determine that it was the Brita water filter producing acid water, which was irritating her bladder every day. Spring water is the best. So that's concept number one. Concept number two is there a chance that you have a chronic infection? Could you have a chronic fungal infection or a chronic bacterial infection? And again, or even a viral infection. Again, now we know that some patients have viral infections, and that is in fact supported again by our own National Institutes of Health, who released a paper this summer which said they found polyoma JC viruses in about 10% of the samples they tested. So some of us might have a viral infection. We know the viruses, Epstein-Barr or polyoma viruses. So you, again, could have a next generation test to determine if there's something unusual in your urine. And, I like data. I don't like guessing. Man, you know what? If I've been in pain for 3 months, 4 months, whatever, I want somebody to look and I want somebody to study it. I'm not interested in guessing anymore. I want facts. I mean, once you've suffered and once you've been up all night crying your eyes out, begging for somebody to help you, you could kind of come to the point where you realize you deserve more than a guess. And that's what I like about this. Is this just data? It's just data. It's useful information. But Boria, the third thing we've got to think about is actually burning. The symptom of burning is actually a pelvic floor symptom. A muscle that is working hard is a muscle that produces lactic acid, which burns. So you remember, if you were to go run, eventually, because you're running hard, your legs start burning. Okay, why? Because you're working the muscles hard. And it just produces acid in the muscles, and that causes burning. So the same thing happens in the pelvis with the pelvic floor. If the pelvic floor muscles are working hard, they are going to start burning. So you've got some things to rule out here, hun. And it's good that the AZO is helping you, and that the water that you're drinking water, be normal. But we have to ask, and what you've got to ask the doctor is, why is my bladder more vulnerable? Or what is causing this symptom? We don't just want to focus on managing the symptom. We want to try to figure out the cause of the symptom, right? Rosanna says, cutting out sugar, caffeine, gluten was very helpful for me. Yeah, absolutely. Let's see. Lauren says, I'm in a horrible flare with a kidney stone in my system. No fun at all. I can feel my bladder spasming when I put my hand over it. Oh, hon, I'm so sorry. Kidney stones, poop. suck. Borea says, would bladder builder help? Possibly. If you've got estrogen atrophy, if you've got a chemical injury to your bladder, something like that, something that will put a coating on your bladder, like Elmeron, would be the most appropriate therapy in that moment. But unfortunately, Elmeron is now known for causing severe eye disease and blindness in some patients. And so, if you're currently taking Elmeron, you absolutely need to have your retinas examined. There are very specific retinal examinations that should be done. We know that that eye damage has the potential of progressing even after you stop the medication. And so patients are choosing fairly quickly to move away from that. So where do they go? They go to the chondroitin-based supplements because the bladder has chondroitin in it. There was years ago, 25 years ago, one of the therapies for IC was liquid chondroitin called Uracyst that was put directly into the bladder as an instillation, and that was approved in Europe and in Canada. It was never made U.S. approval. And then there was a condition called hyaluronate, also known as cystostat, which was again approved in Canada and Europe for IC, but not in the US. And now today, the most popular installation is going to be either Ialuril, Ialuril, which in Europe, it's available in Europe and Canada, and it is a combination chondroitin hyaluronate installation, or in the United States, a heparin lidocaine installation, where heparin also can have that coating. But, with COVID and not wanting to go into the doctor, which of course we certainly all understand right now, just to be on the safe side for people who don't have insurance, the American Urology Association in step 1 of their guidelines says, hey man, try the supplements. Why? Because supplements have fewer side effects than Elmeron and fewer side effects than the other therapies. So if you look at the AUA guidelines for IC, you will see that they recommend supplements. They don't recommend brand name, but let me just tell you what they are. Let me grab them here real quick. All right, let's see here. Now listen here, you guys, I'm not trying to sell you. I don't want to sell you on anything. My job is to show you your option. I just want you to know what your options are, and then you can read more about it, talk to your doctor about it, et cetera, right? Okay. So, how do I want to do this? Let's do it historically, because the supplements were actually, they were first invented by IC researchers and urology researchers. So the first supplement that was ever produced, I don't have it anymore. It's an old formula that is just ineffective. It's called Cysta-Q, and the Q stood for quercetin. Quercetin has an anti-inflammatory effect proven in the bladder, and that research was done by UCLA many, many years ago. So Cysta-Q was the first supplement that was created for chronic prostatitis and IC. They had Prosta-Q and Cysta-Q. There's no bladder coating effect in that. The next supplement that was created was Desert Harvest Aloe. It was created by two sisters, one of whom had IC, and they were aloe aficionados, and she felt that aloe was very calming and soothing to the bladder. And so they created their company, Desert Harvest, and then the two sisters got in a really big fight. Attorneys were involved, and they split into two separate companies, and there you go. Desert Harvest has long supported the IC community. We're very grateful for all of the work that they've done over the years to support IC events and outreach, et cetera, et cetera. The founder of that, Pat Cressito, is just a dear, dear, dear woman. The challenge with aloe is that for some people, they're just intolerant to it. And so aloe is out there. It's used by many, but some people simply cannot do it. So the supplement that dominated the IC world for 18 years or so was Cystoprotec. As soon as it came out, it became the top dog. Why? Because it was the first supplement to include chondroitin and hyaluronate for a bladder wall. So Cystoprotect has two methods of action. It has a bladder coating effect combined with an antihistaminic effect created by Dr. Thea Harides, a federally funded ICU researcher at Tufts University years and years ago. I took this. Tons of patients have tried this. And the thing with the supplements you've just got to understand is that we all have individual tolerance levels. Some people can take it, some people can't. You just have to try it. Like for me, we always say to patients, start with one capsule, see how you do, one a day for a week, see how you do, move your way up, and of course, talk with your doctor about these options. I could do one a day, no problem. I could not do two a day. When I went to two a day, it upset my stomach and it gave me the runs. But I could do one just fine. So whenever you're taking a supplement, it's about finding what works for your body. And what was interesting, at least for me, is it felt like warm cotton candy in my bladder. I mean, it was kind of cool. But here's the thing, and I remember the first person who ever, once this was launched, the first person who called me back and told me it was working for her was a woman who had severe arthritis in her spine. And she was stunned that it was really helping that because chondroitin, glucosamine, which is also in this, is in fact often used for arthritis. So again, this was hugely popular for many, many years until last year when unfortunately they put a cancer warning on the label because of an ingredient called titanium dioxide and it destroyed the brand. I mean, it just literally the company offered no explanation. They didn't put out any warning. They didn't tell us. And it was just a debacle of debacles. Thankfully, it took them 10 months, but they finally fixed it. The titanium dioxide, which was a white food coloring in the capsule, is now removed, and the cancer warning is now gone. But the capsule, instead of being brown, is now red. So Cystoprotect is now back for people who just love Cystoprotect. But we've learned a lot about IC since then. And because Dr. Theorides had a non-compete agreement, he could not update his formula. So a new doctor, Dr. Gio Espinosa at New York University, is the director of integrative urology. About 6-7 years ago, he created Cysto Renew. And so Cysto Renew very quickly got a pretty loyal following. I'm going to say maybe 75% of the patients who were taking Cystoprotect switched this and they loved it, but others really like the old Cystoprotect formula. So this one has 4 methods of action. It has a bladder coating effect. It's got from the chondroitin. It's got the antihistaminic effect from the quercetin. It has a little bit of aloe in it for the soothing effect of the aloe. But most importantly, what makes this very, very cool is it has a nerve calming ingredient called lemon balm. Lemon balm is the mint with a lemony scent. It's not citrus lemon. But he was the first one to really target the nerves. And that's really, again, now we know about nerve sensitization driving a lot of these symptoms in so many patients. And really from this point forward, the supplements are now really trying to also help calm nerves down. So Cysto Renew came out. And then 2 years ago, a new company came on board called Natural Approach Nutrition. And they partnered with some of the top IC researchers and put together a small committee. I was also on that committee, and we were just trying to reimagine supplementation, right? Is there something new that we could do? And the end result of that wonderful partnership was Bladder Builder, which I now believe is the top supplement on the market. It's getting really, really good reviews. So it has like 7 methods of action. So it has the coating effect from the chondroitin. It also supports the bladder wall with collagen. It's got the antihistaminic effect of the quercetin. It's got beneficial probiotics in it for the gut. It's got some essential amino acids in it. It's got probiotics in it. But most importantly, it has palmitoethanolamide, PEA, which in a research study last year was found to be remarkably successful at reducing pain in IC patients. That was a research study presented at the American Urology Association in 2019 by researchers in Europe. Palmitoyl ethanolamide, also known as P as in Paul, EA, PEA, has been used in Europe for a couple of decades. Many dozens of research studies. They have tested it with fibromyalgia, with sciatica, with burning mouth syndrome, with lots of pain conditions. And the data continues to be astonishingly good. And I've known about it for about a decade. We had a couple of compounding pharmacies who were trying to import it for Americans. So it's just too expensive. So it was nothing we could really talk about, right? It was just like thousands of dollars. So in the study, they had a group of patients, IC patients, who had not responded to any other therapies. They gave them a combination of PEA and resveratrol. The name of the supplement in Europe is called UMP, UMPEA. And by month 3, 87% of patients had a significant reduction in pain. And by month 6, 25% were pain-free, and the rest were doing very well. And when that study came out, the doctors were ecstatic because they can't give opiates like they used to. And so to be able to have something that also reduces pain is really important. And for some people, that's what happens. And so Bladder Builder has been out for about 2 years. And we just did our 1-year follow-up study. And in that study, 60% of the patients who tried it continue to use it. 40% stopped. They stopped because either they couldn't afford it, or their doctor wanted them to do a therapy, or they had a side effect. And the side effect with this is the same in the other ones, a little bit of gut distress for some patients. But of 60% of patients who continue to take it, I think it was 22% were pain-free in our study. I published it on our website. They had less painful flares. They had shorter duration flares, and they just had fewer flares with Bladder Builder. So Bladder Builder was a real game changer because it was the first bladder supplement that also included PEA. But unfortunately, some of you cannot take anything with probiotics in it. You flare. Why? Because if you have a histamine issue, some probiotics will trigger a histamine reaction. So if you notice that you flare when you take a probiotic, it's all about histamine. And so what they did is they created a very clean, pristine formula for people who are more sensitive that's called Bladder Rest. And so Bladder Rest, same thing. It's got the chondroitin for the bladder wall. It's got quercetin for the bladder wall. And it's got sodium hyaluronate in it. So it's just like Sister Protect, except it's not in the olive oil base. It is in an avocado oil base to make it a little bit more heat stable. So Bladder Rest for people who tend to be a little bit more sensitive is an option. For those of us who have normal bladders and we don't need something that contains chondroitin, there's Peora, which is just the PEA and resveratrol. And so this is really viable for those of us, myself included, who struggle with more nerve-driven pain. And so when people say, what am I taking? I take this because my bladder is healthy. It's really my central nervous system that's screwed up. We also have now Allopath, which is a combination of aloe and PEA. So it's kind of taking aloe to the next level, as you've got the coating and soothing effect of the aloe combined with the potential pain reduction of the PEA. So for those of you who like aloe, we think that this is going to, give you just a whole new option that might help a little bit more with pain. And then we have something brand new, and this is our giveaway today, Cystomend. And Cystomend has 1, 2, 3 methods of action. So it's got the chondroitin and the hyaluronate for the bladder wall. It's got quercetin for the antihistaminic effect. Let me see, am I missing anything? It's in an olive oil base to improve absorption. But what this has is pumpkin seed extract. And pumpkin seed extract is known for its, what did we call it? Hold on. Let me look. I don't want to get this wrong. Ooh. I want to talk about that. Hold on. Let me open up a new window real quick. Oh, okay. And so it has the pumpkin seed extract for its anti-inflammatory and antioxidant effects. Okay. So the first 2 people who email me your snail mail address, my email is icnetwork@mac.com. I will send you a free bottle of Cystomend if you'd like to try it. Now, again, guys, now listen, we're all different. If your fundamental problem is pelvic floor dysfunction and your bladder wall's healthy, the chondroitin-based supplements make no sense for you. In contrast, if you've got estrogen atrophy and your bladder's more vulnerable, or you've got chemical cystitis or chemocystitis, then doing something with chondroitin makes sense. And so, it's all about matching what your unique needs are. And I can't tell you what's going to work for you. All I can do is just kind of show you potential options. And I have a transition guide on our website for patients who are trying to get off of Elmeron, and that's what they're switching to. They're switching to the Cysto Protects, the Bladder Builders, the Bladder Rest, and now the Cystomend. That's basically what's going on. Taylor says, "What's the best test for yeast in the bladder?" Pathnostics, which is a company, or actually, it's Microgen. You know what? I think with Pathnostics, you get more bang for your buck, kind of, sort of, because I think they normally will throw in a viral screen that Microgen does not throw in. I think you have to pay extra for the viral screen for Microgen. But Microgen's super, super easy to work with. And so, I mean, they're both viable, and it would be interesting to do both if you could afford it and compare the data. Brittany says, "Is sex always painful for IC?" No. What we have to ask is, why is sex painful? Sex is usually painful because you're either dry, because you might have some estrogen atrophy, or you have tight pelvic floor muscles. If you've got tight pelvic floor muscles, it's going to make it hard for you to empty your bladder, to have a bowel movement. It's going to be hard to release things out of your pelvis, and it's going to be hard to put things inside of your pelvis, like a penis. And so normally when we see a woman who's got pain with sex, we're going to look at their pelvic floor muscles. Sharon says, "What doctors know about this? It sounds like there are amazing doctors in the US." Well, hun, there are some amazing doctors around the world. But it's a pretty small pop community overall, and it's kind of hard to reach them. But you could go to Robert Moldwin in Long Island. You could go to Robert Evans at Wake Forest University. Ken Peters at Beaumont. You could go to Christopher Payne, who authored the subtyping system that I use. He's at Vista Urology in California. Look at you guys. Send me your email. All right. Good. Unfortunately for Canadian patients, the Canada system is really, years behind the rest of the world. A lot of Canadian patients come to the United States. Adlin says, can you give advice on bladder installations? My mother is diagnosed with IC and the installations with heparin, apparently. Okay, so Adlin, so we would want to know first what they found in her bladder. Does she have Hunner's lesions, these big bloody wounds in her bladder? Or did her bladder look normal? If they found Hunner's lesions, installations really aren't going to do much because lesions require lesion-specific therapy. Lesions can be stunningly painful. And the greatest tragedy when is talking with somebody who's bawling their eyes off in pain. They're down to eating 4 to 5 foods, only to discover after the fact they were diagnosed with Hunner's lesions, but they were never treated. Normally, lesions are treated when they find them and they cauterize them, they laser them, or they inject them with a steroid. And what's amazing is when you treat the lesion, the pain usually goes away in the great majority of patients. The challenge is the lesions sometimes come back. Lesions have now been, there are kind of 2 theories behind lesions. Number one, that it's a viral infection because that's what the researchers in Europe found. Polyomyx BK virus or the Epstein-Barr virus has been found in the urine of patients with lesions, or it's a nerve that is massively, massively inflamed. But we generally know that Hunner's lesions do not respond particularly well to bladder installations, other than perhaps a temporary numbing effect from lidocaine. If she doesn't have lesions, if her bladder wall looks normal, then the odds are she's got estrogen atrophy because of her age. And let me grab my handy dandy favorite slide right here. So here's a 3-dimensional picture of your bladder wall. So we have an inner coating, a mucosal barrier that acts as a barrier to prevent irritants in your urine of reaching here, the urothelial cells, the largest single cells in the human body. Combined and directly underneath that, we've got nerves in green and blood vessels. Unfortunately, this nice thick mucosal barrier is estrogen dependent. So when you're young and you have lots of estrogen, you have a lot of protection in your bladder. But when you're older or you have a hysterectomy or you go on birth control pills, what happens? Look at that. The mucosal barrier gets thinner and thinner, and all of a sudden, whatever irritants are in their urine get down to where they start to cause damage. And this is what triggers the frequency, urgency, pressure, pain. So this is an old Elmeron slide. You can see it says Elmeron here, and you can see that their method of action of Elmeron was as a coating, right? And so the same thing as would happen with installations is it would put a coating directly on the bladder. And the most popular installation right now is going to be a rescue installation with heparin and lidocaine. And they will sometimes they put other ingredients in there too, a steroid and antibiotic, stuff like that. We have the formulas for the different installations that have been published on our website at icnetwork.org. You could also do an Elmeron installation because when you put it in the bladder, it's not believed to absorb significantly to penetrate into the blood vessel. So that's kind of, I mean, think about it this way. If you swallowed a Band-Aid, is it going to come out the other end of Band-Aid? The answer is no. You have digestion. 93 to 95% of Elmeron is rendered inactive by digestion. So when you swallow it, it is the least effective way to take a bladder coating because most of it does nothing. And that's why you have to take a lot of it over time for Elmeron to make a difference. And that's now why Elmeron is now associated probably with eye disease, is because you took a lot of it over time. But when you put Elmeron in the bladder, 100% of the medication arrives in the bladder. It is a much more effective way of treating the bladder. The reason why Elmeron was created was a lot of women didn't want a catheter. So anyway, Adeline, there you think. Again, it's about knowing what the underlying problem is. Does she have Hunner's lesions or estrogen atrophy? You should, at a minimum, she should be following the diet. You got to break her cup of coffee a day habit or green tea or soda just to give the bladder an opportunity. Remind her that as we get older, the bladder gets a bit more vulnerable. and something that she was enjoying in her 30s and 40s, her bladder might not be able to defend itself with in her 50s or 60s. Okay. Angela says, I had a labral tear, 3 hip surgeries in the last 2 years. You're 2 weeks post-op. Girl, oh man, I hope your surgery went well for you. And it's so important that people understand that underlying hip issues will stress the pelvic floor, diminish blood flow to the bladder. And there you go. I call it the chicken versus the egg dilemma. Which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor. The odds are they're both involved. And they're both involved because they're so interconnected. But our job is to try to figure out which one is primary and which one is secondary. One is driving the other. One is driving the other. So if your IC began after chemotherapy, then we know what the problem is. And we know that the chemicals from the chemo have damaged your bladder and your muscles are getting tight to protect you from that pain. So our therapeutic priority for the chemical injury patient is to calm and soothe the bladder. And if we calm and soothe the bladder, the muscles will release. But what about the patients whose symptoms started after falling on their tailbone or having a baby or a rape or history of athletics? You have no idea you have a muscle injury. Your first symptom is frequency urgency. You call the doctor. Doctor, I think I have an infection. The doctor goes, all right, let's give you an antibiotic. They throw antibiotics at you. It doesn't help. You call the doctor back. I still have an infection. The doctor goes, well, let's test your urine, but give you antibiotics anyway. Your urine test comes back negative. Uh-oh. Then the doctor goes, you know what? I think you might have overactive bladder. So let's give you some overactive bladder meds, Detrol, Ditropan, Myrbetrix. They don't work. You go back to the doctor. The doctor goes, hey, it's not working. The doctor goes, yeah, man, I hate to bring this up, but I think you've got this incurable bladder disease called interstitial cystitis. And I'm sorry to break that news to you. There's no treatment other than Elmeron, and here's the diet, and they send you on the way. And then they give you Elmeron, it doesn't work. You could be on Elmeron for 20 years, it doesn't work. Why? Because your problem was not with your bladder. Your problem started with a muscle injury. And our therapeutic priority for patients who have muscle injuries is to restore blood flow. How do we do that? With pelvic floor physical therapy. And the AUA guidelines are crystal clear. If you are not responding to therapy, if you are getting worse rather than better over time, you have to take a step back, bam, hold on, and let us revisit this diagnosis. Have we missed something? Have we missed something? Could it be a muscle injury? Could you have a fibroid tumor? Could you have a Tarlov cyst on your spine? Could you have a fungal infection? Could you have a mechanical injury because of a bad hip? It's a fabulous time because now we're understanding this diversity, and patients are finally getting relief. And Nicole here says, put in a order for Bladder Builder because it helps with their pain. So look at that. There we've got something that might help with your pain. LKN on YouTube says you have pain as your bladder fills. Okay, then that points us to the bladder wall. Nicole says, do I wear an SI belt for my SI joint, or I wear it for a loose SI joint that hurts? And I sat too long 2 weeks ago and I just messed it up again. Shannon says, you have pain after urination and you feel better when splinting. I have a rectocele. Would this contribute? Okay, so here, hold on. I got to look at what you said earlier. Shannon, if you've got pain after urination, then that tells us it's probably not your bladder wall. And you asked what my opinion of embedded UTIs are. I think that there's a small percentage of people who might have an embedded UTI, but certainly not everybody. Anybody who says everybody has embedded UTI is not living in the real world. But you feel better after splinting and you have a rectocele. So the fact that you have a rectocele tells us your muscles are weak and dysfunctional. And the fact that when you splint like I do, you feel better, again, points us to a mechanical dysfunction for you. And I would want, if I were you, to have a really good pelvic floor assessment. Malia says, I take narcotic painkiller for end-stage liver disease, and it does nothing for my pelvic floor spasming. Well, that's because it's a pain medicine. It's not an antispasmodic. And Malia, honey, I'm so sorry that you're going through this. I'm so, so sorry. You ask your doctor if you can do a skeletal muscle relaxant. Now, that's going to be baclofen, Baclofen, or Flexeril, or even a vaginal Valium suppository. I don't know if you would be restricted from using that because you do have liver disease. Talk to your doctor about that. But I would not expect pain medicine to stop spasming. You have to use an antispasmodic. Jan says, I have burning pain until past urine and sometimes blood in your urine. Jan, if you can see visible blood in your urine, that is a very important symptom that you have to bring to the attention of your doctor. That is abnormal. Most IC patients have microscopic blood in our urine, and that's really not anything, usually not anything to worry about. Although normally what they would do if they see blood in your urine is something called a urine cytology test. And it's, you just pee into a cup and they send it off, and they look for cancer markers, because blood in the urine is potentially a symptom of bladder cancer. So if you were a smoker, and then it's really important that you have a urine cytology test, because smoking is the #1 cause of bladder cancer. But it's also a sign of perhaps a bleeding Hunner's lesion. And if there's any chance that you have a Hunner's lesion, then you want to get that treated, right? Sometimes I forget to drink. You know what I'm trying to do now? I ended up in the emergency room a month ago after my flu shot, and my heart started racing, and I threw PVCs for 4 hours. I drove myself to the emergency room with my heart out of control at 6 in the morning. Would you believe? Didn't call an ambulance. No, I drove. Yes, I did, because I wanted to be able to drive myself home. And when I got there, #1, I was dehydrated. And #2, I've been drinking decaf coffee, and that just finally, for me, I just have a point where I can only do so much over several months before my heart becomes much more sensitive. So now I'm off coffee for 6 months again. And I only drank decaf, and I only drank a little tiny bit in a Frappuccino, but you know what? I'm a redhead. That's what happens. But most importantly, I had a low potassium level. I was stunned. And they gave me a shot of potassium, and my heart stopped PVCing, and everything went. So now I am making sure I'm having my banana every day. I'm trying to eat high potassium foods. And yes, I am drinking Gatorade. And you know what? Well, I think I had like 2 PVCs last night while I was reading, but it might have been gas on my stomach. But it's amazing how much better I feel now that I've got my potassium level up again. We were in the fires. I was evacuated. My house all burned down. You just don't eat. I hadn't eaten well for about a month. Alrighty then. Isn't life an adventure? Yes, it is. Lindsay says, and you guys, we're going to be starting our Zoom meeting in a couple of minutes. During the Zoom meeting, this gives you the opportunity to come into Zoom and ask your questions. And last weekend, somebody asked if the Zoom portion was video, and it is not video. No one will see your face. It is okay. Lindsay says, I have pain in my hip flexor, and I have no idea how that happened. I've had pain since I was diagnosed with IC. I don't feel the pain all the time. So, Lindsay, if you got pain in your hip flexor, you need a pelvic floor assessment, #1. But it's going to be interesting. It's going to be interesting to look at the mechanics of your pelvis and your legs. Have you been wearing a lot of high heels or inverse heels? You know, the old earth sandals? Oh, see, that's what happens when I drink too much. I get gas on my stomach. Oh. Um, or are you walking differently? Do you have shin splints? Do you have Morton's toe, Morton's neuroma? Is there something going on with how you're walking, which could be influencing your hips? Jan says, I have lots of pinpoint pinpoint bleeding after cystoscopy and apparently had a small cyst that was diagnosed with IC. Would this show as blood in urine? You know, Jan, are you the one I talked to this week about having cysts in your urine last week? I mean, in your bladder? Um, I mean, you know, generally, this type of bleeding, they no longer believe is suggestive of IC. We no longer need this to make a diagnosis of IC. We now know that sometimes these red spots happen on the bladder just from the test. That when you stretch the bladder with fluid, it's gonna react like this. I did work with a lady this week who had calcium deposits on her bladder. And let me show this to you. I want you to see what this looks like. Look at this. If you have sustained a serious injury in your urinary tract, what happens is a calcium metabolism gets disrupted. And that calcium starts to extrude from the bladder wall. And this is called a bladder stone. And you can see, look at all the, I mean, you can see that it's crystals, right? You can actually see that it's crystal. And what we know about these stones is they're sharp and they get covered with bacteria. So, man, this is a freaking bacteria factory right here. But most importantly, when they break off the bladder wall, they sometimes get blocked in the urethra. And so generally, this only happens after a major trauma. Like this is a friend of mine. This happened to him after they had to sew his bladder up. It had split, and they had a giant incision, and they basically had to resuture his bladder together. Not an IC patient, it's somebody else, but it's severe damage to his bladder wall. And he probably had 1,000 stones over a period of a year in his bladder. It's just brutal. Kristen, is there any way to find out if I have an infection? I just got diagnosed with bad bladder infection, which made me go see the doctor with extreme nausea and pain and back pain. I just thought I had a flare. I probably would have had to go to the hospital. I tried azo urine tests, but they always come back as being inconclusive. You know, Kristen, I've done the same thing. I've only had 2 bladder infections in 27 years. Both times I thought they were flares. And the second one, I waited 6 weeks. And by the time I got there, I was a wreck, and it was a miracle. It wasn't a kidney infection. Yeah, you can order a next generation urine test. You know, I mean, if there's any way you can do this, that would be great. Most doctors also will just normally, for women who get recurring infections, they will just give you lab slips. So when you start feeling it, you can just go do that. And if it's the same bacteria over and over and over again, like E. coli, we have to wonder, number one, is it a drug-resistant bacteria? Or number two, is there something in your daily life that is infecting you, like a bathtub, like jets in a bathtub? If it's different bacteria over time, we might want to look at your immune system. But more importantly, if you're menopausal, it could just be estrogen atrophy. Remember, the purpose of this coating is not only to keep chemical irritants off of these cells, but also bacteria. And so if your mucosal barrier is now compromised, bacteria can reach these cells and infect them very, very easily. And so generally, what they normally do, once you've had like 2 infections in 3 months and you're of a certain age, they're like, all right, this could be hormone related. in addition to giving you antibiotics, they would normally give you an estrogen product. Because what the research studies have found for these patients is the bacteria is usually living very happily in the vagina about 24 hours before it arrives in the bladder. And of course, the researchers just said, what's happened to the vaginal defenses? And the answer goes right back to estrogen atrophy. You could do something like Prevent or Allura. Here, hold on. Let me get into Zoom. Oh, God, I did this again. Hold on a sec. How did I do this last time? How did I do this last time? Hold on. Let's see here. Oh, the joys of technology. Not. I hate it when your computer logs you out of everything and it requires you to re-sign in. All right. So, yes. All right. So I'm starting out the Zoom meeting right now. I'll start it up and I'll put the invitations in chat. So hold on a sec. Invite, copy, link. It is copied. All righty. Okay, YouTube. Jan says, I'm amazed how much knowledge you have about the bladder. Yeah, hon, you know what? It's just, it's fascinating to me. And luckily, I have the education to be able to go through a lot of the research. All right, YouTube, you have your invite. And Facebook. Oh, God, I really hate it. I always scare myself that I'm going to accidentally shut something down. All right. Now, you guys on Facebook, listen. When I scroll down to enter the link for the Zoom meeting, I'm going to lose a lot of your questions. Please don't take it personally. If I miss your question, just ask it again. Amanda says you burn a lot when you pee. And so if you're burning on the outside, peeing, that is estrogen atrophy. Cara says she's got the polyoma JC virus and the Epstein-Barr virus. What can be done if you have those viruses? It's going to be an antiviral medication. Think about what they would give for somebody with shingles, and as well as perhaps using lysine. We've just started to dive in the lysine research. Lysine has been found helpful for preventing herpes infections, cold sores, things like that. It might be very interesting to add the amino acid lysine to there. All right, so you guys, I'm going to lose about 50 questions on Facebook. I apologize, but I have to do that to put this link in here. All right. Amber says, I had low back pain since I was 15 when you fell downstairs and landed right on my tailbone. A year or two later, I was diagnosed with IC. They said my bladder was inflamed and looked irritated, but didn't mention lesions. Can back injury cause bladder inflammation? Yes, it is called a somatovisceral reflex. Does a muscle injury influence the health of the bladder? And the answer is yes. We call that the somatovisceral reflex. And I can talk about that in depth. But okay, guys. So Lindsay, if you don't wear heels, then it would be very interesting to look at, what else might be going on. All right. So you guys, Shannon says, how can I get Zoom links in the future? By email? Just come into the meetings. I have the links actually posted on our website. So I have to manually let people into the Zoom meeting. Eileen is coming in right now. Eileen, I'm going to mute you. If you're not muted, please mute yourself. Oh, she's connecting. So I have to let you in one at a time in the Zoom meeting. Please be patient. If we've got 20, that's fine. If we got 2, that's fine. Whatever your pleasure. I am not invested in any specific platform. So you guys, if you would like to share your story, if you would like to get a little one-on-one coaching, you can come into the Zoom meeting. Again, the Zoom meeting, people will hear you, but they will not be able to see you unless, except for the other people all in the Zoom meeting, and you activate your video. If you don't activate, that's fine, but you are going to be heard by people watching on YouTube and Facebook. So let's just all go take a bathroom break. Let's take a bathroom break for a minute. Y'all come on in if you want to come on into the Zoom meeting, and I'm going to go use the restroom, and I will see you guys in a minute, all right? Or two. Because seriously, are we not the fastest peers in the world? Of course, unless we have pelvic floor dysfunction. I'll be right back. All righty, my friends. All righty. And look at who I see first, but what am I doing? Donna. Hello, Donna.
Whitney, how are you?
I am very good. Here, let me just put these links back in Facebook and YouTube. Hold on. All right. So you guys, anybody who wants to come on in, feel free. Once we do this, we will come back to Facebook and Zoom, and Facebook and YouTube, and we will take your questions again. I don't know about you, but I'm enjoying myself today. I hope you are too. I hope you're getting some good, useful information. Of course, we want to make sure that we thank our sponsors for this meeting, which is Preleaf. Thank you, Preleaf, the only supplement that can help reduce acid in your urine. Please do not take it like candy. You only take it before here, hold on. I got to mute somebody. Let's see. So Preleaf, I should have mentioned this first, is actually the oldest supplement that's been used by the ICU. Take it before a meal if you're going to eat something. It reduces the acid in the foods that you're eating, and it might reduce irritation to your bladder if you are diet sensitive. All right, but please don't take it like candy because it is calcium. If you're prone to calcium-based kidney stones, this is probably not something you can take because the calcium has to go somewhere, right? And so if you take too much, you could start throwing stones. So don't eat it like candy. But it's been around for 30 years, very, very successful. 1 or 2 caplets before a meal is viable. All righty. Get that in there. I'm very grateful. And also, guys, if you do find these meetings helpful, please come on over to our website and you can become a member and get our fabulous magazine. Right? And this is how I do my in-depth articles. So our fall magazine, which will be out, I'm always like, listen, during fire season, I'm always going to be late. It'll be out probably early December. Is all going to be dedicated to chronic overlapping pain conditions, as well as a wonderful patient story of an IC patient with autism. And I love, love, love what they wrote. So we got some good things. Look at this. We got a full house here on Zoom. Welcome, everybody. It's so nice to see you. So what I'm going to do is I'm going to call on you guys one at a time, and I will turn on your mic, or I will have you turn on your mic, and then let's just do it. All right, and we're going to start with Donna. Hello.
Hi, sweetheart. How are you?
You're one of my favorite people in the world.
No, baby, you know what? I'm getting off early. I'm not going to say too much because all I wanted to do was see your voice, see your face, and say, hi, baby. I love you. And I'm so glad that you're and your family and your dad. Happy birthday to him. His birthday. Oh my gosh. That's all I wanted to say. And happy,
thank you.
Hey guys, I love you guys. Eileen and Jan and Amber and Ursula and Lindsay and Nicole and Lisa. God bless all of you. I'm getting off. You know I am, but I just had to say something. I just had to say, I love you, Jill. I just had to do it.
Right back at you. Right back at you. I love you too.
I'm not pain free yet. I'm doing better. So I want to make it legit. I'm doing better and I'm hanging in there. So thanks to all of you and thanks to my Jilly. Thank you so much. God bless us all. Okay.
You are very welcome. All right.
I love you.
See you later.
I love you.
Okay, so now you guys, for everybody else in the room, it would be helpful if you turned on your camera because so that I can see. Thank you. And don't take it personally. Because I don't remember who came in first. And so don't take it personally if I don't call on you right away. But you know what? I'm going to go to Ursula first. And Afton, you're next. Hello, Ursula. How are you doing today?
I'm good, thank you. This is really exciting. Thank you for calling on me.
You are very welcome. How are you feeling today?
Well, so I've had problems for many years with my bladder.
Okay.
And I've tried to resist using drugs.
Sure.
But it seemed like after I hit menopause, things got a lot worse.
Yeah.
So I have a lot of problems sleeping at night. I get up a lot and I'm exhausted all the time. And that's my biggest problem. Also, I used to like to run, and about 3 years ago, I was able to run a 10K. I had given up caffeine, and that helped quite a lot. I'm trying to work on my diet really hard right now, and I did see a urogynecologist, and he did a cystoscopy, didn't see anything in the bladder. He did prescribe for me desmopressin to take at night, and I thought I'd go ahead and try it.
Okay.
And I don't know if you know what that does, but apparently it like inhibits your ability to produce urine at night. And I don't know. I'm kind of
okay. So
uncomfortable taking something like that. But he wants me to have my electrolytes checked every couple weeks. So I don't know what to. And one other quick thing I wanted to tell you that I noticed was when I sit down at night to relax in my recliner or my chair, I get a lot of burning and pain. But I am also sensitive to diet. So like alcohol and. So yeah, I have a lot of burning down.
So I always hate asking about age, but I kind of have to do it because number one, you certainly do not look old enough to be menopausal. But how old are you?
Thank you.
You don't.
I'm gonna be 54 in December.
Okay, and yeah.
Woohoo! Thank you.
How old were you when your symptoms started?
Well, it's really hard for me to say exactly. I honestly have this weird suspicion that it's just a thought that I have that it started when I was young in my 20s after I took a foam spermicide.
Okay.
I felt like I had a really strong reaction to that and I stopped taking it.
Okay.
But I've kind of just had problems for most of my life that I can remember, like starting in my 20s. But like I said, it's gotten a lot worse since I.
Okay. So tell me, were you an athlete?
No, I was never. I used to ride horses.
Okay. That's like That's
But
actually
it was
important.
like
though.
just once a week, you know,
I
and I
know.
haven't done that in a long time, like 20 years.
Okay,
So,
but did you ever fall? Did you ever get kicked off? The bucked off?
no, I don't think I ever fell off.
Okay. Okay. So, okay. So again, we're going back to your 20s. So your symptom in your 20s was some frequency, urgency. Do you remember having pain in your 20s?
It's kind of hard for me to say. It was so long ago.
Okay.
I think I had it, but it was never debilitating like it is now. You know, I never had problems sleeping so much at night, and it just gotten like worse with time. And I used to be able to have like a beer, you know, once or twice a week.
Okay.
And coffee, and now it's just I can't do anything
Okay.
fun.
Okay. So we have one giant clue here, and that is they looked in your bladder and your bladder was normal.
Mm-hmm.
And so what that tells us is that your problem is your fundamental core problem that began in your 20s, in all likelihood, with some sort of either endometriosis or a fibroid tumor. But as soon as you said you were riding horses, I was also a horseback rider. That brings up pelvic floor injury again. Hold on a sec. So were you writing Western or English?
It was English.
English? Okay, me too.
English, yeah.
Okay. So I want you to look at this picture just for a moment. So this is a bicycle seat, right? And you can see that the bicycle seat is basically pushing directly into muscles and nerves, right? And you can see the nerves right here. And let me grab my favorite thing of all, my comedy routine, to be quite honest. Okay. So here's the pelvis, right? From the inside out. And now let us ponder what riding a bike or riding a horse would push up against. And if you were posting, right? So you guys posting, if you're an English horseback rider, I don't know if I can demonstrate it. You're doing this as you're riding, so that your crotch, your crotch, your legs are carrying the bulk of the strain when the horse is trotting or when the horse is cantering or galloping. And well, except you don't post during your gallop. But anyway, okay. So every time you sat down on the saddle, you pushed directly into these tender bits. And what is that going to do? What is that going to do? So there are two reflexes in the pelvis you've got to understand. One is called the viscerosomatic reflex. And that is, can the bladder change the behavior? Whoops. See, I told you. Can an organ change muscle behavior? And the answer is yes. If you have a bladder infection, your bladder's screaming with the infection and your muscles are going to get tight in a guarding reflex, right? So this little thing can make all of these muscles tight. But the more important question is the somatovisceral reflex. Can a muscle change organ behavior? And the answer is yes. That if these muscles are injured, they are going to restrict blood flow to the vulva, right? So we might see some vulvodynia. We could see a reduction of blood flow to the bladder. And eventually, I explained it earlier, the bladder gets involved. Muscles get compressed, blood vessels get compressed. So let me ask you this question. Well, is sex comfortable or not?
Certain positions are better than others, but no, I usually have to take a bathroom break. My husband's like used to it. I'm like, I gotta go pee.
Okay.
Because the longer it goes on, then I become more and more uncomfortable.
Okay. So, and what about, did you just dread going to the OBGYN and having your annual pap smear because of putting the speculum inside of you?
Not really.
Not really?
I mean, it wasn't like a big deal. I mean, I didn't like it, you know, it didn't feel good, but I mean, it wasn't super excruciating or anything.
Have you had a pelvic floor assessment?
No, I haven't. And it's interesting that you say that, because my GI doctor, because I was having issues with like improper evacuation and constipation, he suggested that I have that. So I need to do that then, it sounds like.
You absolutely do. And I bet you good money that you've had tight muscles for some time, and that it all goes back to horseback riding.
I looked at some of the stretches and stuff, and I'm sorry, I don't want to take up everyone's time.
No, it's fine
here, but I did look up some of the stretches and things on the internet and tried. So would that be helpful to do?
Not right now, because you don't know what muscle group is the problem.
Okay,
so
I mean, assessment, of course. Right?
So there's 3 layers of muscles. The shallow muscles are the levators, and they go from your tailbone to your pubic bone, right? And then below these, we have another group of muscles. And then you also have muscles that are higher up. So there's basically 3 layers of muscles. And so their job here is to try to figure out which muscle group is dysfunctional, so that they can give you the correct stretches and exercises. You would not do a Kegel. Kegels would only make this worse. Amanda says she's in the meeting, but she can't hear us. Amanda, you got to turn your sound on. Check your microphone setting, because everybody else can hear me, hon. It's one of your settings. So concept number 1 is when we normally see this in somebody who's younger, we always want to go back. We want to make sure that that there was some sort of trauma, because if we can find that trauma, that's usually a giant clue. And so the odds are you have had long-term muscle issues for some time, and I want you to call me and let me know what they say. So there's a fabulous website, pelvicguru.com. And
I saw that from another video you did.
Right. So so what they're going to do is assess your muscles, and you need to tell them you were a horseback rider. And any other traumas, can you remember if you've had children, if you've fallen on the ski slope or on ice going out to your car? Try to remember any traumas you've had. They're going to look at your legs. They're going to look at your hips. They're going to look at your core. They're going to look at your glutes. They're looking for muscle tension patterns. And then
I have a little bit of scoliosis, so too, my hips are a little misaligned a little bit.
Okay, me too. I have scoliosis too. So what they're going to do in the exam, when they do the internal part, is they're just going to gently touch muscle groups. That's all. And if they can reproduce any of your pain, that is spectacular. So, but now we've got the other issue, and the other issue is you absolutely are menopausal, even though you don't look like it at all.
Thank you. Well, that's nice.
So we do know now that's probably why you're more sensitive to certain foods, is because you're losing a bit of that estrogen. And so number 1, have they given you any topical estrogens, anything at all like that to use?
No, I've only seen this doctor a couple of times, so no, he didn't mention that.
Do you feel dry down there? Like during set?
A little bit, yeah, probably.
So just remember, if your vulva's dry and your vagina's dry, so is your urethra, so is your bladder. Your urethra is kind of like the canary in the coal mine when it comes to estrogen atrophy. It's the first part of the urinary tract that will often start screaming. And so you will feel urethral irritation, or like there's a drop of urine stuck in your urethra that won't come out. And
sometimes I do feel like something's kind of stuck in there.
Right.
Sounds lovely, I know.
Yeah, no, that's just a very classic symptom of estrogen atrophy. And normally what they will do is just have you put a pea-sized drop of estrogen cream on your finger and rub it right into the entrance to your urethra. So
that's over the that's with a prescription.
Yes,
right?
it's with a prescription.
Yeah.
But guys,
okay.
For everybody watching this, the quality and health of your skin as a woman is something we all have to pay attention to, because it is going to influence your bladder over time. And so it's kind of a separate but related issue. Again, if your vulva is dry and your vagina is dry, you have to realize that your urethra and your bladder are also going to potentially be involved in that too. And so, have them look at your skin, see how you do. Patients respond beautifully to the estrogen cream. It is considered very low risk. The safety studies are second to none, and you can Google that and see that. And then maybe since you're not sleeping well at night, what do you think? How many times are you getting up at night?
Like even with the desmopressin, like I have to get up sometimes 3 or 4 times before I fall asleep.
Okay.
And then I get up like at 3 or 4, sometimes even more than that, unless I'm completely exhausted or I take something like Benadryl or something that I don't like to take to just knock me out.
So let's just make sure you're not accidentally shooting yourself in the bladder and causing some of this. Do you take a multivitamin?
I stopped all that.
When did you stop?
Maybe like a month ago or something
Okay.
like that.
And did you notice a change in your nighttime frequency when you stopped a little bit?
No.
Okay. Do you do any, are you doing any coffee, green tea, soda, anything at all like that?
I was just, okay, coffee has been hard for me.
Yeah.
So I went to this low acid quarter caffeine coffee, and I seem to do pretty good on that. But and just like rooibos tea and mint and chamomile. But I had a little bit of regular coffee today, and it got a lot worse.
Okay, so understand that if you have estrogen atrophy, which you must have at your age, your bladder just can't defend itself from the coffee right now. You got to lose it. And
even the quarter cap,
yeah,
just stop it.
Well,
okay.
See, the caffeine is like a cattle prod to your nervous system. The reason why we like coffee is because, at least for a lot of us, it's nice because it helps you have a bowel movement in the morning. It gets things moving, and cognitively, we're wonderful. I mean, I write like a beast when I do coffee. But unfortunately,
I'll give it up. I mean, I'll do anything at this point
to
feel better. To sleep through the night.
Okay, so I think you need to lose a coffee through the new year and just see what happens, and stick with the chamomile and peppermint and maybe a little bit of the rooibos.
Okay.
Because
I can do that.
That long-term nighttime urination usually reflects a daily irritant, and if you've been drinking coffee every day, you haven't given your nerves an opportunity to calm down. Okay. So I want you to carry hope in your heart. Listen, there's nothing scary about your story. There's nothing that I understand that you're exhausted and you want this to go away. And I have been there. Oh yeah. Well, hello. I just have
under my eyes.
Right.
Yeah.
I can see on your face that you're feeling very, very frustrated by the whole thing. But understand that you're not. We want to put this in context here. Yes, you're sleep deprived and you're exhausted. I get that, but your case is not scary to me. Your case is completely explainable to me. And the mystery here is that we don't know what's going on with your pelvic floor. And I would bet you $50 you have an underlying pelvic floor issue.
Okay.
And
thank you so much for your time. I really, really appreciate it.
Well, hey man, we're all in this together. We are all in this together.
I'm learning.
So I want you to try to get to that physical therapist. In the meantime, do things that will relax muscle. You guys, if you sign up for our newsletter, you get our free flare management guide, 40 pages. It has a hour-by-hour rescue plan for bladder flares and pelvic floor flares. And frankly, Ursula, it'd be really interesting to it'd be really interesting to see if a muscle relaxant might help a little bit. You could talk to the doctor about that. But if they find that you've got, go ahead.
Oh, should I ask the Euro gynecologist to do the pelvic floor exam? I guess that would be the person, right?
Yeah.
Okay.
Well, they'll do an introductory exam. It'll take them 5 seconds to do it. Yeah, your muscles are tight. And then they send you over to the pelvic floor physical therapist. But if she finds that your muscles are tight, you can talk to her about, hey, could we do maybe a little trial of a muscle relaxant? And let's see if that will help too, if she finds your muscles are. And make sure you tell her you're a horseback rider, but make sure you tell her that sex is uncomfortable. Okay? All right, hon. Big, giant hug to you. Okay.
Oh, thank you so much.
You are very welcome. All right, let's go to Afton. Hello, Afton. How are you today? Okay, I've got to unmute you. Hold on. Or can you unmute yourself? There you go.
Can you hear me?
Yeah. Hey, how are you doing today?
I'm good. How are you?
I am. You know what? I wasn't sure how I was going to be this morning, but I'm feeling pretty good right now. So there you go.
Yeah, that's how it goes for us, right? We never know how we're going to feel.
Right.
Exactly. Well, what can I help you with? How are you doing?
Oh, hey, baby.
Hi there.
I started having pain 2 years ago after my third child.
Okay.
And I'll try to make kind of a long story short, but we went through a whole lot of tests, a whole lot of antibiotics. Nothing seemed to work. Nothing was shown on ultrasounds or vaginal exams. Most of my symptoms when it initially started were kind of like urinary tract related. It seemed like I had a UTI, but they couldn't find anything. And I had some pressure, kind of like pressure, like in my rectum, pressure, in my pelvis.
Okay.
So after about 6 months, they finally diagnosed me with pelvic floor dysfunction, in which I went to pelvic floor therapy. I've been going to pelvic floor therapy for over a year and a half now.
Okay.
And my symptoms have not gotten any better.
Really?
So no. And so my doctor did suggest that it could have been pelvic congestion syndrome. That was kind of the last thing we resorted to. And we did an MRI and my gynecologist said she didn't see anything on the MRI.
Okay.
But after she told me about PCS, I went home and I did some research and I was just floored by the symptoms and how much they related to me. I mean, I've got every symptom. So I took it upon myself just recently to call a vein doctor. I called the vein doctor or the Vein Institute out of Rochester, and I had a virtual doctor appointment with him, and I told him my story and I shared all my symptoms, and he said if he were to diagnose me based on symptoms, he would say absolutely hands down it's PCS.
Okay.
I do have an appointment scheduled. He got me in for November 30th and they want to do a CT venography.
Okay.
And I guess I'm just wondering, I guess I'm just looking for some more validation.
Well,
honestly.
Okay, so
and some more information.
Sure. Take me back to physical therapy. When you went to physical therapy for the first time, what did they find? Were your muscles tight? What did they say the condition of your pelvic floor was?
They said that I did have a lot of tightness in my muscles.
Okay.
And I'm not going to completely rule out that there wasn't pelvic floor dysfunction. I think that may have very well been part of it. I mean, I know with these things, you can have a combination of things wrong. So,
right.
I can't say I can't say that the symptoms didn't get any better. I can say that the symptoms have not gotten better as far as my cycle with my period and and before my period and those types of things. But I do feel like there was some muscle tension.
Okay.
I'm not ruling that out. So I think probably the pelvic floor therapy did help a little bit, but I just, in my gut, I feel like there's something else going on.
So, did the physical therapist notice that your muscles relaxed and then got tight again? What was happening consistently?
Yeah, she seemed to see a difference in my muscles relaxing.
Okay. Okay.
However, I have not seen a difference in the symptoms.
Okay, but Ash, okay, and do you do internal wand work yourself?
I do not on myself. I mean, my therapist did a lot of internal stuff.
The wand work is really interesting because it really helps you kind of connect the dots with respect to, gee, it hurts here because this muscle's tight, or it hurts here because this muscle's tight. And it shows you you can feel the consistency of your muscles. So like for me, the muscles on my left side are now pretty good. You know, I can move along the length of them, but the muscles on my right side are just kind of thick and jumbled and immediately painful. And it takes a couple minutes for it to kind of calm down. So I guess the point that I'm getting at here is I'm curious as to if you have recurring tension. Does it get better and then get worse? Does it get better and get worse? Because Dr. Jerome Weiss talks about this. Where's the book? In this book. Breaking Through Chronic Pelvic Pain. And he introduces, so Dr. Jerome Weiss was one of the pelvic pain specialists in California for many years. He was a urologist who back in the 70s saw that bladder therapies were not working. And so he was the first mainstream urologist to really look beyond the bladder at other structures in the pelvis. And he became a specialist in the myofascia, in the muscles and the fascia. And he got so good that if you had a trigger point, he could massage it out that day, most of them. If you had an activated nerve, he could calm that nerve. What baffled him is why did the trigger point come back in exactly the same spot a month later? Why did the exact same muscles in the exact same spot come back? So the therapist would work it, but a week later, 2 weeks later, you'd be right back to square one. And he's the one who introduced the concept of a mechanical dysfunction. Is there a problem with a bone? Is there a problem with something else that is affecting and stressing the muscles in your pelvis? So, for example, do you have one leg longer than the other?
I did. My pelvic floor therapist actually noticed that, and we did some work on that. Okay. And is that fixed or has that come back? No, that has not come back. The last time I went, she checked again and she said it looked really good. And that did alleviate some of the pain. But like I said, I feel like my concern is the pain that I get with my cycle, with my period, before my period. It's just, I don't know. I mean, well, but normal to me. But remember the chicken versus the egg dilemma. Which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor. This all began for you after you had a baby, right? Yes. So how was the delivery when you had the baby? Was it hard? Did you have a C-section? No, Did you get torn? No, I had 3 vaginal births. Okay. My first birth was very hard. Okay. And then the other 2 were a little easier, but. Okay. Were you, when you were younger, a gymnast, an ice skater, a bicycle rider? Do you remember any pelvic falls, falling on your tailbone, anything? Oh yeah, I was a cheerleader, so I fell a lot.
Okay. So here we go. So we have a foundation of pelvic injuries. You fell a lot on your tailbone or just on your hip or your pelvis. Of course, you were young, your body's flexible, you're resilient. You might not know that you have developed some trigger points. They might have been asymptomatic, but every fall you take a toll for every fall. And then you had 3 children, and your first delivery was a very, very hard delivery. So we know that your muscles were stressed that way. And so then we have to kind of look at mechanical issues. Is there a mechanical issue which is perpetuating long-term chronic muscle tension? It's possible. It's possible.
Right.
But with that somatovisceral reflex, we do know that the bladder, it's hard for the bladder to be healthy if it doesn't have good blood supply. And so concept number 1 could be that your bladder wall is struggling to be healthy because it has poor blood supply. Or concept number 2 is that the childbirth did result in some pelvic congestion syndrome. And I am not as familiar with that as other people. I did a big story on it in my last magazine. Here, hold on a second. And if you send me an email, if you send me your email or you send me your mailing address, I will send it to you. Is this it? Hold on. I just have to find it. Because I gave away my display copy last week to somebody who was really not doing well. Is it this one? No, it's not this one. All right. Well, anyway, the dominant symptom that I'm the most aware of, aside from some frequency urgency, is this heaviness, feeling heavy as the day goes on. So is that true?
Yes, that's exactly. I mean, I feel a heaviness in my pelvis, in my lower back. Just like, it almost feels like my insides like ache or hurt.
Right.
That's kind of, I guess that's the only way I could describe it. Like sometimes I say, I feel like my ovaries actually hurt. Like they ache.
Okay. Well, I think I am completely in support of you working with the interventional radiologist and just trying to rule this in or rule this out. Because the thing is, with pelvic congestion syndrome, it's very treatable and it's easily treated. The problem is making the diagnosis. And so you got nothing to lose. So why not give it a shot and see what they've got to say?
Right. So I guess my question to you is, if it turns out this is not the diagnosis, could it still be possible that my diagnosis is just pelvic congestion or pelvic floor dysfunction, and I just need to continue physical therapy? But how long do I do physical therapy? The rest of my life?
No, it's until, this is where you've got to work with the physical therapist and really try to understand how your muscles are changing over time. If your muscles keep reverting back to a tension pattern, then we've got to figure out why those muscles are in a tension pattern. And it could be a bad SI joint, it could be a bad hip, or it could be how you're walking. Maybe you have if you're pigeon-toed, if you're duck-footed, if you have shin splints, if you have anything like that, that will absolutely make your pelvic floor tight consistently over and over again. You need to get this book. You need to get this book. I think it'll really help you. And it's free on Kindle Unlimited, but I think having the book that you can highlight is important. And the pictures of the feet are stunning. The chapter on the feet are amazing.
Really?
Yeah. It's just stunning how I did not understand how the feet will mess with the pelvic floor so badly. So
really,
I would get this and do a little bit of reading on this. Okay.
Okay.
Well, I hope I helped a little bit. Pop me an email. icnetwork@mac.com. Pop me an email and say you want the Pelvic Congestion Syndrome magazine. And if you want, I'll email it to you or I'll snail mail it to you. Your choice.
Okay. Let me just write that. Can I write that down? What did you just say the email was?
IC Network, all lowercase, no spaces, IC Network at mac.com.
At net.com.
Mac like Macintosh computer.
Okay.
Okay. All right, Afton, you let us know. Well, I hope you have a nice holiday with your children.
Thanks.
All right. All right. See you later.
Bye.
Bye-bye. Okay, I'm going to come to Shannon next. And you guys, please don't take it personally if I'm just, I don't have a good system for picking people. Shannon, are you there?
Yes, I'm here.
All
Can you
right.
hear me?
I can hear you. What can I help you with?
Well, I guess there's two questions. So I've done Microgen DX twice, and I have 3 different bacteria that have shown up.
Okay.
And, I started on this journey of long-term antibiotics, which I've stopped. And I do have a UTI now.
Okay.
And I'm getting treated just for, it showed up on my regular UA.
Okay.
And I'm getting treated now. What are your thoughts? So with me, I don't know if it's my bladder, and I'm working with a pelvic floor therapist. It's funny how you started, you said, or you just were talking about the feet. Yeah. And I just saw an osteopath, and he told me, your injury is not, because I have my neck and shoulder issue. He's like, you're from the bottom up. It's not right. Top to feet. Right. Because one of my legs is longer than the other. Right. And he did some work on me, and I'm going to see him again this week. But I was like floored. And you just mentioned that, and I'm like, oh my goodness, this is crazy.
Oh yeah. Yeah. It's stunning.
So what are your thoughts about this? And I know you've heard about it because it's everywhere, because a lot of people with IC actually do the long-term antibiotic route. But I'm just, I'm really, I don't, in my body, I don't know if it can handle it, to be honest. I just don't.
Well, the proof is in the pudding. The proof is in the test results. But we all have to understand that microgen testing is going to reveal everything. It's going to reveal good bacteria, bad bacteria, and fungi. Right. And of course, the challenge lays in interpreting the data. So, as an example, look, I have my test. The last test I had. What was this test? So, for people who don't know, let's see, a microgen test is very interesting. I want to make sure I don't put personal information on here. I just want to. So, I just to kind of give you guys a clue of what a microgen test will look like. And so they will list on one side the bacteria they find, and then they will also list what the most effective therapy for that is if it's a pathogenic infection. And in this case, this was a vaginal swab because I was sure I had this candida infection. And what I had was lactobacillus, 92%, which is completely normal, Prevotella, 3%, Streptococcus, 2%, and Gardnerella, nothing. Like a trace of Gardnerella, which is hysterical because I haven't been in a relationship for years. So it's like, all right, I don't know how the hell I got that. But the question is we don't know what a normal biome is. We just don't.
Right. And that's what
Right. And so, and what happens, and I interviewed the CEO of Microgen, and I said, what about those patients who keep chasing infection? So they've got 10% enterococcus, they go after that, then they have another test, and now they got 10% something else, or they got 5% something else. Do you keep chasing the infection? And the answer is no. And in fact, if you're not symptomatic and they find it, you don't treat it anyway. So on this one, I had this test done because I wanted to rule out fungi, which it did rule out, and it helped me understand it was a pudendal nerve entrapment that was giving me pins and needles in my vulva rather than a candida infection. But you know, there is from day one, back to the old internet newsgroup days, before we even had Facebook, we had massive discussions about people who said it was all drug-resistant infection, embedded infection, et cetera, et cetera. And the reality is that's just not true. That we have all of these potential causes, from pelvic congestion syndrome to chronic muscle dysfunction, to the new research study that found that 70% of men with testicular pain had a hip issue. And so we're long past the days of using long-term antibiotics for these patients, unless you have a culture which proves it, So,
well, go ahead.
So the second thing we have to ask ourselves is, if you keep getting infection over and over again, are you in estrogen atrophy that's made you more vulnerable to that?
Sure. And that's what I'm thinking too. Well, so I'm 48. I'm perimenopausal.
Okay.
And my infections started happening this year. So I had, these symptoms, I see symptoms since 2017. I had a hydrodistension in 2017. It worked for about 4 months, and then my symptoms all came back.
Okay.
And I've been fighting it till this year. And then this year, January, I had a ESBL E. coli in my urine.
Okay.
And it was a pretty massive infection.
Okay.
And then antibiotic after antibiotic. And then I joined, groups that are like, no, IC is just a chronic infection. And there's biofilms, and you need to break through the biofilms in order to kill the infection. So this long-term antibiotic can be a year long, right? And I'm like, my gut is dead. I mean, my body can't handle it. And I've just been spiraling down. I thought there has to be more to it than just that.
Well, there is. There's much more to it than that. And, you just didn't know and didn't understand that structures outside of the bladder can cause all of these symptoms: frequency, urgency, pressure, pain. That can all happen from a tight muscle, from a Tarlov cyst, from a fibroid tumor. Lots of different things can can injure the bladder, or at least trigger urinary frequency urgency. We had one study, just so you know, of patients who took antibiotics. I see patients who took antibiotics for 10 years. And they all believed that it was chronic infection. And yet when you went and looked at their lab tests, only 1 out of 50 actually ever had a positive culture. The bladder only knows one language: frequency, urgency, pressure, pain. Everything feels like infection in the bladder. A bullet wound would feel like infection. A chemical injury would feel like infection. That's the only way that it can tell you that there's a problem. But you're different in that you actually did have a pretty significant infection, and you've had a couple. And so our question would be, why? Now, we know a lot of infections are coming from contaminated food, contaminated pork, contaminated chicken. So that's one way that you could get a pretty severe drug-resistant bladder infection. We know that certain types of bathtubs with jets in them, if the jets don't drain popular, the jets become nice little bacteria factories. And so if hot tubs, things like that, the Center for Disease Control has released that data, and it's pretty alarming. You couldn't pay me to go into a stranger's hot tub, but God forbid a hotel hot tub. There's no way on earth I would ever sit in that. And it's just massive contamination of bacteria. I don't subscribe to the belief that it's hygiene issues. I think that that's very unfair to women. The thing about the vagina is that it's the cleanest organ in the human body. It sloughs off its cells every 4 hours. But what we do find is we do often find bacteria living in the vagina about 24 hours before it arrives in the bladder. And again, the question is why? And the answer comes back to the quality and health of your skin and estrogen atrophy. So you may be one of those patients where you were just, your estrogen levels were dropping, 3 years ago when this started, and it was making your bladder more vulnerable. You know what you need to do is you need to Google the genitourinary syndrome of menopause. And let me type it out in the chat.
Okay, perfect.
You need to Google this, and you need to look at the symptoms. And let's see if you're in this group. So hold on.
Let me ask you this too, with the pelvic congestion. So I had this where, this was back in June, and I kept getting this where it felt like, and I'm the one that asked the question at Facebook, like splinting helps relieve it. Like I feel like there's nerve involvement down in my peritoneum area. I had a pretty traumatic childbirth in 2011. I mean, and I had a episiotomy, so they just cut.
Okay.
But I couldn't, you know, she was in distress, so they had to get her out. But
sure.
You know, I mean, I can splint, and my physical therapist, you know, I told her, I said, for some reason, and I had a pessary placed inside of me. And I did it because I have the rectal prolapse, and it's like a 2+ going into the vagina. And I'm like, is that causing my problem? So we had the pessary put in for a week. They did a trial, and I felt better.
Well, you didn't mention the rectocele. You didn't mention the pessary. So,
what is, tell me about it? Uh-huh.
Well, I mean, clearly your pelvic floor is abnormal.
Right.
And your pelvic floor is not functioning correctly. You've got muscles so weak that you've now developed a rectocele. I have a partial rectocele. It's a mild rectocele, but and that's just from straining to have bowel movements, because back in my 20s and 30s and 40s, I didn't know that I had a muscle injury and I was pushing. How many of us do that? And so the quality, I mean, your muscles are already pretty severely compromised, but the piece that you're missing, and I want to hold this up here. So look, these are your levator muscles, right?
Right.
And so we've got your urethra, we've got our vagina, and we've got our rectum. And the perineum is this area right here.
Right.
And the perineum is a hot spot. This is where we often see really severe pain, is right in this area. Have you noticed that?
Oh yeah, that's where I splint.
Okay.
That's where I have to splint, because that's what takes the pressure off. I'm telling you, like, there's been times I feel like there's a bowling ball in my pelvis. It's
okay. So if we were to put this back on, directly underneath the perineum is what we call the perineal body. It is an attachment point for 4 muscle groups. And the reason why the perineum gets sensitive is because there's a muscle dysfunction directly underneath it, affecting the perineal body. And the fact that you're splinting there, now I know for me, okay, so guys, now listen, I have no shame. I will talk about anything, and I have no problem using my body as an example. So my prolapse pushes this way. It's just there's like a little tiny cavity just on the front side of my rectum. And so there are moments when something gets stuck there, and I have to use my finger and push it back so it'll come out. Do you have that?
No, I don't think so. Mine just falls into the vagina. It goes into the vaginal wall. So
mine doesn't go into the vaginal wall because it's mild. Mine pushes out a little bit. It tends to push out a little bit. But the fact that you're splinting right there says it's a muscle issue, hon.
Right.
You got
physical therapy.
Yeah, you need a really thorough pelvic floor examination. And you absolutely have to get this book. You have got to be able to walk into the doctor's office, the physical therapist's office, with the name of the muscle that you're splinting. So you have to be able to describe to them what you're doing that's helping you. The fact that you're manipulating muscle and you're feeling better tells us it's muscle for you.
Right.
Have you had
that affects your frequency? Like last night, I woke up this morning, I'm like, oh, I feel like, so I'm being treated for UTI now, and I'm like, and I've been on antibiotics probably 10 days.
Yeah.
And I'm still having symptoms. Like, so, and apparently, the antibiotic's sensitive to my bacteria via UA culture and sensitivity. And I'm like, oh my gosh, I feel horrible. Like right now, I feel okay. Yeah. Well, I've done those tests and I know it's going to come back positive, but here's the kicker on that. When that happens, we go back to embedded infection thing.
Yeah,
and that's what this whole.
I know, but honey, an embedded infection would not respond to you splinting a muscle. Apples and oranges here. The embedded infection is a fanciful theory supported by a very small but very vocal group of people on the internet that have been around for 27 years. And they are completely invested in this. And they have, and in fact, I was talking with one of the people that basically helped to invent part of that work. And she was outraged at what was happening online with people talking about embedded infections, and that she had been working with patients who had followed that line of theory and had damaged themselves so badly from the long-term antibiotics. So honestly, I would not, apples and oranges here. If you feel better splinting a muscle, then we have to look at that muscle. I mean, have you even had a pelvic floor assessment?
Well, yeah, I have. I am working with.
Oh, you are working with. That's right, you are.
And I told her, I told her, I said, I don't think I'm tight. And so she pushed on the muscle and she agreed. She's like, no,
you're not
really tight.
You're not tight because you have a rectocele. We know you're not tight.
Right.
But you need to ask her, have you shown her what you're doing, how you splint it and how that makes it better? And
I have told her that. And she's given me some exercises, but she told me we can work on it. But she said you're about between a 2 and a 3. So
okay.
I'm not a minor rectocele.
And so it may be, there are moments when, unfortunately the rectoceles get so big that the only way to fix them is with either a pessary or surgical repair. And, yes, you have infection. You have an active infection right now that would exclude you from a diagnosis of IC. I mean, you are not presenting like a typical bladder wall patient. You are presenting like a muscle weakness injury patient with a rectocele, and the symptoms that you're having are far more associated with, outside of the bladder. And you got an infection. It's an incidental infection, but that doesn't mean it's a chronic infection. I mean,
and that would also explain, I guess it's multifactorial, but also the frequency. I mean, I get up 4 or 5 times a night to go pee. Easy.
Well, okay. Now listen. Western medicine fails to treat the pelvic pain patient because doctors don't look outside their specialty very well.
Right.
And we all have to understand that all of these structures influence each other. That muscles irritate nerves and they irritate organs and vice versa. And we are doing the equivalent of unraveling or revealing layers. He talks about revealing layers. And there are often many different things going on at the same time that are all triggered by one initial event. We've got bladder sensitivity, we got muscle dysfunction, we got constipation, we got skin sensitivity, we got vulvodynia. And their origin, the genesis for all of that begins usually with some sort of trauma. And so you can't look for one thing to make all of this go away. We're trying to solve a puzzle here, and we have to focus on each piece of that puzzle, each layer, to try to understand what's triggering what, if that kind of sort of makes sense. So is long-term antibiotics going to fix your muscles? No. Is that going to help anyway with your prolapse? No, it won't.
Right.
Do you have a chronic infection because of estrogen atrophy? Maybe. And you've had the testing, you have an active infection now, you're going to get that treated. And then you could do something like Prevent or D-mannose as something that would help you build defenses against infection. You've got
Is Prevent. So anything, and I'll tell you, anything like I feel my bladder gets inflamed. Okay, this is what I'm feeling. So when I drink something or even take like a cranberry supplement or something, I'm like, I'm through the roof. It's not. It doesn't feel good.
Well, so Prevent is a proanthocyanidin product. It's a PAC D-mannose product. There's no acid in it, even though the PAC does come from cranberry. So normally with a woman who gets recurring infection over and over, they will either put them on Allura or Prevent. This is Allura is a little bit more expensive, but the research shows that PACs, proanthocyanidins, are the most effective at helping to prevent infection. Okay. But the question is trying to figure out why you're up at night so much. Let me ask you this question. Does it change with position? Do you pee less when you're on your back versus on your side versus on your front?
It doesn't.
Okay, so we don't have positional symptoms. Is there anything you're doing on a daily basis that might be provoking the heck out of your bladder? Are you drinking a cup of coffee a day?
I have, but I stopped coffee, but now every now and again I'll have a cup. Well, not every now. I'll drink a half a cup.
Okay,
and I'm just like,
Stop it.
Okay.
You have to stop the coffee. Because the coffee is triggering the nerves, which are triggering your frequency urgency at night. You have no choice. I mean, at least for the end of the year, stop the coffee.
Okay.
And maybe do chamomile.
Mark, what you doing?
Chamomile herbal or peppermint herbal. You know, and just give your nervous system a break here, because you're pounding your nervous system with a jackhammer right now with the coffee, and that's just not okay.
Well, Jill, I mean, this has been an awful year for me. And I'll tell you,
for all of us,
from the beginning, you know, I had the infection all through the year. Then June, I came up with tinnitus. So my nervous system is in complete overdrive. Like I can't, and I've done a whole workup for the tinnitus, and it's just basically my fight or flight is going. And I'm a nervous person anyway. And I have, you know, this mysterious itching on my arms, like these rashes that, I mean, I'm very sensitive. I'm like, oh my gosh, this is awful.
See?
Yeah. Yep.
Yeah. Yeah.
And so I know, you know, it's all playing into each other, but I just am like, that's my big conflict is I'm like, I don't want to do long-term antibiotics. I am scared to death of it. I've done on and off antibiotics all year long. And now I'm, you know, I feel like my gut's paying the price. Plus I'm like, well, I've killed everything. So yeah, I'm going to get these recurring infections because I don't have any.
I mean, you've destroyed your biome. I mean, somebody gave a really good example of what an antibiotic does. And what an antibiotic does, it's like taking a flamethrower to a rainforest. It's killing everything above ground. The only thing left is whatever's in your skin. And you're creating the perfect environment for you know, dysbiosis. You know, you're losing the normal population of good bacteria that would keep the bad bacteria in check. So hopefully you're taking a probiotic and stuff like that to try to restore your gut. And kind of we have antibiotic stewardship protocols now where we're really trying not to go in and destroy the biome anymore. We understand the toll that antibiotic use is taking. And that's, again, why the long-term antibiotic people are meeting such resistance. I've talked with several doctors who just won't go there because of the context it takes to, you know, to all the important living beneficial bacteria. You know, in your gut, as an example, there is one bacteria that makes the one food that the cells lining your gut eat. The human body does not make that food. Only this one bacteria makes that food. And if you kill that bacteria, the cells lining your gut cannot eat and they start to die. And our best guess here is that there is a bacteria in the bladder. I think they've identified 4,000 different species, potential species. That there's one that does the same thing to the bladder wall that produces the food that nourishes the bladder wall. And I'll leave you with one really interesting tidbit. There was a wonderful documentary a couple of years ago, and they were trying to understand what the correct food is. Because obviously for those of us who live in most countries, our biome has already been destroyed and altered by antibiotics because that started in the 40s. So we don't know what a normal biome is. The closest they can get to that are to some people in Africa or indigenous people, maybe in the rainforest, who are basically eating meat and nuts. And they've been able to collect those cultures to try to understand that. And we know that they are not getting the cancers and all that sort of stuff that we are getting because our diets are so screwed up. But then they went back to what's considered the most important food ever, mother's milk. Mother's milk.
Oh, okay.
And when they studied mother's milk, what they found is that it doesn't contain food that nourishes the infant's body. It contains prebiotics that nourish the bacteria in the gut. That mother's milk is basically building the biome in a young child.
Okay, yeah,
and
that makes sense.
Yeah. So I mean, I understand you're all over the place. You've got muscle issues, you got bacterial issues, you got bladder wall sensitivity issues, and you just have stuff you got to rule out, hun. We got your muscle issue is separate and distinct, and if the pessary worked for you, then you might need to keep using the pessary. If you got estrogen atrophy, you got to work on that. Maybe the topical estrogen will help. And maybe that's why you're getting recurring infections. Okay.
I agree. It's such a mess. And I mean, I'm very distraught. This year has been and for everyone, I know, because of everything going on, but I thought, I don't know if I'll make it through the year. I mean, I'm okay. I'm not saying I'm going to do anything, but this has been a really, really, really tough year.
We are all, man, all you got to do is look at our faces. We are all exhausted. I mean, honey, if you could see, I have massive makeup on right now. You should see the bags under my eyes. I mean, this year has taken a terrible physical, mental, and emotional toll on our body.
Yeah,
and it is what it is. You've gotten this far. We're going to get through this, but we now have to take time to calm our nervous system. You have to embrace really good anxiety management. Don't let yourself catastrophize. Don't start thinking the world is ending if this person or that. I mean, that's a real tragedy of kind of our election right now. Is every side says the country's going to die with the other side, and it's so sad. It's just manipulation and catastrophizing to the nth degree, and it's feeding all of this. Listen, the country is not going to go away. When we work together as a support group, we help each other, we nourish each other, we give hope to each other. What I don't want you to do is sit in a room alone and catastrophize and say everything's going to be bad, because it's not true. There's nothing that you have that scares me. There's there's no symptom that you're having that I find personally frightening. It's all explainable. And every one of these things, there are questions and answers that we can work through, but I'm not scared for you in any way. I just want to get you sleeping again, just like I want to get Ursula sleeping again, right? Because it takes a toll when we don't. I slept terribly 2 nights ago.
And
And
then emotionally, it just, yeah, I mean, it's just, I was diagnosed with sleep apnea in August too. So I thought of that, and then I'm not sleeping. I'm like, oh my gosh. So I literally feel like I'm going crazy. I'm like, I feel like I'm going crazy.
Okay. And you need to tell your doctor that. You need to be really clear with your doctor that it's just not helping. Listen, I love journaling. I love journaling. And the reason why and so my rule, and what did I do with you know what? My journals are out in a storage box now. I had them all over there. The rule with a journal is it's about releasing it. It's just about getting it out of your body. Because right now you're spinning like this. Your emotion, right. You just can't stop yourself. You're going from this to this to this to this. And our goal is to try to stop it. And our goal is to try to release some of the stress. So the rule is 3 pages longhand before you get out of bed. You have a journal right next to you. And it's a small little journal. It's not a big size journal. And just write down and release your fears. Just release it. Release everything you're worried about. Just write it down. And then before you go to bed, at the end of the day, same thing. Just write down what pissed you off that day. What drove you crazy that day? You can swear, you can cuss, you can say you hate people, you can do whatever you need to do to our goal is to just get it out of you.
Okay.
And you do not reread it. If you're going to reread it, you have to wait a year.
Oh,
this is not about you going back a week later and rereading and revisiting all of this. That's the last thing we want to do. It's interesting. I saved mine and I read them a year later. And you're really telling your story of where your stress level is, but you're not living in it. But better yet, have a ceremonial burn once a week, tear it out, burn it, let it go. We have got you got to release the stress. You just got to let it go. And again, don't you dare read it. Don't read it over and over again. Tear it out, burn it. Because it's not what you write that's important. You can write that you hate the world. You can write that you hate anybody. It's okay. You can curse, you can scream.
Okay.
It's about getting it out of your body, releasing it. And I'll tell you, well, let me just, I have gone through some moments of pretty severe depression, not in the last 20 years, but in my 20s, I was really, really depressed. And because all this was happening and I didn't understand it, and I felt very unlovable, and I felt like I would never get married and have children, and nobody would ever love me or care for me. And I was like, I might as well just be dead on the side of the road. That's how I felt at that time. And what helped me, and none of that, and listen, I'm here and I'm pain-free most of the time now. And we have answers. We get it. It was never my fault. It's not your fault, but it is your responsibility to build good coping and anxiety management skills. And that's what changed my life, was taking an anxiety management class and embracing positivity. Look at my office. What do I have right here? Whoa.
Book. Oh, wait. Believe. What does that say?
Believe. Right?
Yeah.
If you could see my whole office, it is colorful. It is happy. It is, I have encouraging things everywhere. Hello, love, right? I have affirmations. I've got posters I got nice little paintings with affirmations on them. I don't live in the darkness. My drapes are open. The sun is in. I embrace light.
Well,
okay. I refuse to let myself
so
be in a dark room. I just can't do it.
And that, yeah, and I agree. I just, and I think what makes anxiety worse, though, is that I get on these groups on Facebook and it's like gloom and doom.
Well, yeah, I mean,
it's awful.
Okay.
It's like, I've got to stop.
You got to
but I'm looking for answers.
Okay. Yeah. But they're never going to give you answers because they all have different subtypes. Get the hell off of Facebook. Don't go in the groups. And that's what I say, even our own support forum. Remember, before Facebook, everybody came to our website. I had 200,000 patients a month using our website.
Wow.
Right? And if you're emotionally vulnerable, the last thing you need to be is in a group of people who feel like crap.
Right.
Support groups are always going to be biased to people who are suffering. And you have to remember, for every person having a bad day, there's 100 people having a great day. You're just not going to see them in a support group on Facebook. And the ultimate problem with Facebook, and the reason, like, I shut down the IC network on Facebook like 2 years ago. I was just pissed. And people keep sending me emails of they want me to go into groups and help people. And there are so many of them. It's like, I can't do it all. And then you can't make everybody happy on Facebook, and people attack you for no reason. You're trying to do your best, and you're going to piss off at least one person. And they're so mean. Right. People are mean on Facebook. I've never seen any. Yeah. And so I shut down the IC network on Facebook for about 6 months. And then I had to turn it back on to do a clinical trial. But I was just sitting here going, what could I change about Facebook? Because none of the support group leaders or the group leaders on Facebook don't have training. I have 27 years worth of training. I am a support group leader. And I decided, you know what? Then be what they need. Be a support group leader. And I hope when you come to these meetings, you're getting legitimate, supported data and research that will help you understand what could be happening. And you are the detective. It is your job to take this and go to the doctor and start ruling stuff out. But man, I don't read Facebook support groups. I don't even read our page very often. It upsets me. If people need to get a hold of me, call me. And I'm happy to talk to anybody. And I'm happy to do these meetings through Facebook and through YouTube and Twitch and all that. I'm more than happy to do that. But man, don't read them. They're not helpful.
Yeah, I was off of these groups for, oh goodness, like maybe 3 or 4 months. And because it's like the problem switched to the tinnitus, right? I was going nuts. Now I wasn't sleeping then. And then now my bladder stuff is coming back, and that's when I came back with this infection.
But when you're under stress, you are having a fight or flight response, which is tightening the muscles throughout your body, including your neck muscles, and et cetera, et cetera. I have tinnitus too. Okay. And I have a trigger point, right? I have a trigger point I've had for 20 years. Here it is. That I have never been able to get rid of. It's right there. That is, so breathe, take a step back, breathe one at a time, and say to yourself, listen, there's nothing particularly alarming. I don't find anything particularly alarming about your case. You're not peeing blood. You clearly don't have a major bladder wall injury that we can see. What you do have is some estrogen atrophy and very clear muscle injury. So focus your time there. And then you got to work on your stress management skills, anxiety skills. On our website, we have a wonderful series of guided relaxations created by Beaumont Health. They've been studied in major research studies, proving that when you do these mindfulness approaches, it calms the nervous system. It winds down your central nervous system, which right now is on overdrive for you. Okay. So listen to a guided relaxation at least once a day. Okay.
On the website.
Yes. Perfect. Right on our website, icnetwork.org. All right, Shannon, listen, I got to move on.
Thank you, Jill.
You are not alone, my friend. All right, Amber. Hello, Amber. How are you doing today? Now I got to unmute you. Can you unmute yourself?
Can you hear me now?
Yeah. Isn't it amazing that kindergartners can unmute and mute themselves in their virtual classes? It's amazing. Okay, hon, how are you doing today? How is life?
The last month and a half has been really rough for me.
Oh, I'm sorry.
But but it could be worse, and it's been worse than I am right now. So I'm thankful it's not there.
Okay.
So I guess I just need guidance on like what to do or where to go. When I was a kid, I had overactive bladder.
Okay.
I just peed more than the normal person, and peed more at night, but nothing bad. When I was 15, I suddenly had like severe chronic back pain where I couldn't walk, I couldn't sit.
Wow.
I don't know where it came from. I don't remember falling or hurting myself. And my mom would have to bring me to the ER and they would give me a shot in my back. And then 4 hours later, I could walk again. I tried to go to doctors because it happened again. Like 6 months later, it would happen again.
Was it muscular or was it your spine? What was it?
They didn't look into it. They told me I'm fine, took an x-ray because I was so young.
And
then
what were they injecting?
They didn't tell me, and I tried to find out, but they don't have the records from back then anymore.
Okay.
I'm guessing it was Toradol. It was in my butt.
So they weren't injecting something into your back. They were giving you a medicine in your butt to try to reduce your pain.
Correct.
Okay.
So up to that point, I'm fine. And then then in my late teens, I wasn't even sexually active yet. I started getting multiple UTIs like twice a month. It was crazy. So I was always on Cipro.
Mm-hmm.
Then after that,
and were those confirmed by a doctor?
Yep.
Okay. And do you know what type of infection it was? Was it the same thing over and over and over again?
It was typically E. coli every time.
Okay.
And then the only injury that I can recall that I did to my back, and that was later teens, is I fell on the stairs and landed straight on my tailbone.
Okay. There we go.
To the point where I broke the lip of the step off.
Okay.
And I mean, I didn't do anything about it. I mean, I hurt for a while. I was sore, but it was fine. Also, I don't know if, then soon after that, I ended up, please no judgment, I regret it, but I ended up having an abortion when I was 20.
Okay.
So the step in the abortion happened, and within the next year, I was still getting UTIs. I got a UTI, and then they put me on antibiotics, but the symptoms never went away when the infection did.
Okay.
And then, so I went to a urologist. They did, so I'm probably like 21 at this point.
Okay.
Went to the urologist. They did the MRI of my pelvic area, said it was fine. And he said I probably have IC. Told me there's nothing he can do about it and told me to go home. And I was like crying, miserable, because I mean, as we all know, it's horrible to feel like you have a bladder infection and no one's there to help you.
Right.
So I found a new urologist, and he did a cystoscope. I don't know how to pronounce it, where he looked up with the camera.
Okay.
They didn't say, they said it looked inflamed.
Okay.
And red, but they didn't say anything specifically about lesions.
Okay, good.
I would have to go back and look at the report. He put me on Elmeron and amitriptyline. I also took oxybutynin.
Okay.
I felt relief from none of it.
I wouldn't have expected you to find relief from any of those, because we have to go back to your history. So hold on a sec. So I want you to walk me through this. I want to make sure I really understand your case. So when you were a kid, you suddenly started having terrible back pain. So much so, you had to go to the hospital and they had to give you a Toradol shot to calm you down. Do you have scoliosis?
They didn't say I have scoliosis. I actually just got new x-rays the other day. My upper spine is curved like this. My low back is very off tilt. I have degenerative disc disease.
Okay.
I'm part of a disc. I have a lot of back issues.
Okay. So So I have scoliosis too. I have an S curve, and let's see, I can show it to you. I'm supposed to be an inch taller. If I bend over, Can you see that one side of my back is higher than the other?
Yes.
Okay, so that's not, you needed to see my boobs there. Sorry about that. My breasts. I'm very informal now. After doing this 27 years, it's all about boobs and peeing, not breasts and urinating. So I apologize for my language. So when I was in 7th grade, I had, at the end of the school year, well, right around that time, I had the test over, they traced your back, fine. 3 months later, when I started school again, they did it again. I had a curve. And it was a growth spurt. And there were there was a interesting sequence of events because 2 things happened. Number one, I developed terrible back pain to the point that when I tried to go to sleep and lay on my bed, it was like I could feel my back settling. And there was this moment of really intense pain for like 2 or 3 minutes as whatever the hell was settling. And I couldn't sit at a desk, I couldn't sew, I couldn't bend over and write like that for a long time. And I was in sewing class that my mother believed, teaching it that we all had. I still love sewing to this day. But that was the one thing that scoliosis really stopped me from doing. I can sew for maybe 30 minutes at a time before I have to stop. Because again, I've got an S curve. The other thing that happened is I had frequency urgency. And I couldn't sit through class. I had to pee. I just got pissed off and I'm like, I just need to pee. Pay for God's sake. And they became involved. We called the urologist. They did the x-ray, what was it? It wasn't a voiding cystogram. They did one of the basic x-rays. And anyway, I was with a nurse, sweet little older nurse at the urology office. And she said, "You want to see me develop it?" And I went, "Yeah." And so we walk into the room and we saw that I had an S curve. And I went to her, I said, "I must not be standing up straight. Let's do it again. And I'll stand up really straight." So I went and I stood up really straight. And we did it again. And she's the one who discovered the scoliosis. And basically, it was a growth spurt run amok. I was very top heavy. Listen, the women in my family have giant boobs. My grandmother, I'm not lying, watermelons. When she was older, I have never seen, they were like 2.5 feet long down past her waist. It was stunning how big. And so when I was in 7th grade, I was already a 38 double D. And I also was not fit at all. And so the back pain is from the scoliosis. I think the same thing happened to you that happened to me. I mean, you developed the scoliosis when you were younger, severe back pain. I had severe back pain. I'm just stunned that they missed it because clearly you have spinal abnormalities and it probably goes right back to then. So the question then is, how does that impact your and my pelvis? And the answer is that when you have scoliosis, whoops, my vulva has done a runner. So let's look at, here, I have to change my thing here so I can look at this. So normally your hips are level, and when you walk, your hips are level and they work together, right? But when you have scoliosis, you're tilted. One side is going to be off. And so look at what happens when you walk. It's reinforcing imbalance in the pelvis. It's reinforcing muscle tension on one side and muscle weakness on potentially the other side. Because when you think about scoliosis, so you have a curve like this. So the muscles on this side of the curve are super contracted, and the muscles on the outer side of the curve are now stretched and too long. So scoliosis creates a foundation for just muscle dysfunction. Your muscles have not worked together for a long time. And I've always said, if there's one thing I could go back and change, it would be the scoliosis, because I really feel that that created a foundation for a lot of this stuff for me. So have you had a pelvic, and bear with me if you already answered this, have you had a pelvic floor assessment?
So listening to everyone talk, I feel like I maybe not had the best pelvic floor therapist.
Okay.
It was very quick. She made me put my foot on top of my knee and measured how much I could like bend. But I never had any internal exam. I've never, and the only thing I notice is some symptoms, not all, and not all the time. If they did some outer manual release, I was able to get a little bit, and it wasn't every time. There were only certain times I could. Right. And then so I stopped going. I gave it a try. I gave it a full run. Yeah, but
they weren't doing the right work. This is internal work.
Right.
External work is not helpful. It's internal. It's and you know, some physical therapists love to bring out the wands and the electrical equipment, biofeedback. No. That is not what solves this issue. What solves this issue, whoops. Yeah, I told you. You should see my office at the end of these meetings. It's just torn up. It takes me about an hour to clean it. So the best way to work on these muscles is with a finger in your vagina. And what they do is they follow the line of the muscles. And you know, to the biofeedback, just simply see, I mean, and that's why using the glass wand, whoever I asked, are you using a glass wand? The cool thing about the glass wand is it really helps you understand which muscles are messed up over time. I mean, like I now can really feel where I have to do my work based upon that. And so this is about getting a finger in your vagina and just touching these muscle groups, right? Shallow, deep, and then trying to get the best health that you can, because I do think you and I are, now I have an SI issue on my left side, which is why I'm wearing an SI belt right now. So the SI joint is
that like kind of by the hip, really low?
No. It's about it. It's like right in here. It attaches. This doesn't have a good example. It's the joint that attaches the hip bone to the sacrum. So this is the SI joint right here, right in there. And it's supposed to be a very firm joint. Mine is very flexible, and your piriformis muscle holds the joint together along with some ligaments, and my ligament is stretched out. And so is it stretched out because I've been walking in balance because of scoliosis all these years? Or is it stretched out because I was a tennis player too, which could have done it too? So I think that everything you're talking about has to go right back to having a proper pelvic floor assessment first, okay?
Okay.
And don't walk in and don't walk in and say you have IC. You need to walk in. Your case is so interesting, and you have to start with the back pain that you had first, and really give them a good idea of what your history is. Okay.
Right. It got so much worse over the years to now where it's constant every day. It's like I can't. It hurts to walk. It hurts to get dressed. Like it's chronic.
Where does it hurt? Where does it hurt when you walk?
My low back, it goes into my butt and my hips and all the way down to my knees. And then it started to go all the way down to my foot on my left side.
Okay, so that's sciatica, right? So if you have a shooting pain down your leg, that's a tight piriformis muscle pushing on your sciatic nerve. You have pelvic floor dysfunction. And understand too that that you have muscles that come from your back right down to your hip bones, just like you have muscles that come from your femur and attach up here. And so the pelvis is really the center and the core of the human body. But anytime movement is triggering your symptoms, we're always going to be looking at your muscle tone. If you've got bad feet, you're going to feel it up here. And if you've got a bad back, you're potentially going to feel it here too. So I think a lot of us, go ahead.
I have a quick question.
Yeah.
So I notice sometimes if I use the bathroom and go number 2, sometimes for like a couple minutes afterwards, I'll have some relief of symptoms and then it will come back really quickly.
Okay.
And then there's sometimes I'll go and nothing will happen or my symptoms will get worse. Does that make sense into the pelvic floor?
Yep. Completely.
Okay.
Completely.
Okay.
You know?
And then I have 2 more questions if that's okay.
Okay.
The first one, can like the pelvic floor issues or any of these back issues, can they cause infections like BV and yeast? Because I've been having, so the past month and a half, I got BV and then I got yeast from antibiotics. I've been on antibiotics for a month and a half straight, along with taking Diflucan 150 milligrams for the yeast every day. And I still have the infection. It went to my mouth. So now I have it in my mouth.
Okay.
I just started my period and I was almost out of the metronidazole for the BV. So I went in and they swabbed me on my period. And then now they say I don't have BV or yeast, but I still have it in my mouth. And I don't know if it's accurate. And I just don't, every time I get that, I get urinary symptoms.
Well, of course. I mean, we have research that proves that you can have a candida infection in your bladder. We have our National Institutes of Health proved it, that some patients are flaring because they have an overgrowth of fungus in their bladder. You know, do muscles cause infections? No, they don't. Do muscles make the organs more vulnerable to infection? Possibly, because if those muscles are tight and dysfunctional, the organs are not getting the oxygenation and the nutrition and the good blood supply it needs to be really healthy. If your bladder normally gets 28 units of blood, but it's only getting 10 units of blood because muscles are super tight, or if you've got pelvic congestion syndrome, that was actually from a pelvic congestion syndrome study, that somebody with pelvic congestion syndrome, their bladder was only getting 10 units of blood. It's going to be very hard for your bladder to be healthy and be resilient and being able to defend itself. Throw in the fact that some therapies like antibiotics are going to put you at more risk of candida. It doesn't surprise me at all that you're having issues, but bacterial vaginosis is often, how old are you, by the way? Do you mind me asking?
Nope, I don't mind. 31.
Really? And so are you on birth control? Have you had a hysterectomy? Anything at all like that?
No, back in the day I was taking the pill, but I started to have aura and symptoms. So they took me off estrogen and put me on Nexplanon. So I've had the arm one since I was 21.
So we have a new case study that came out this year of an 18-year-old who, within 2 weeks of starting her oral birth control, had severe lower urinary tract symptoms. And she was diagnosed with IC, infection, candida infection, all of those things. And she saw 4 or 5 doctors before the final one made the connection between her birth control, that her birth control had changed had created a setting where her estrogen level was dropping, which was making her bladder more vulnerable to yada, yada, yada. I suspect that you might also kind of be in that category. Maybe that's why you've got bacterial vaginosis.
I was diagnosed with the IC before I started the birth control I have now that's in my arm. And I noticed that since I was on that, I've had this, the 10 whatever years I've had it, I do get period-induced symptoms as well.
Well, of
So I
course, but
notice since I don't get my period as often on this, I notice sometimes if I'm having a good time, it will last longer than when I was on the estrogen pill. So I don't know.
well, but the bladder is remarkably reactive to hormones. For some people, flare when their estrogen levels are high. Some people flare when their estrogen levels are low, and vice versa. So, the bladder is part of the urogenital sinus. It is remarkably responsive to changes in hormones. It's just there's not necessarily a consistent pattern. We all tend to be a little bit individual. But ultimately, in the end, if I were to bet money, I think that your pelvic floor has been messed up for a long time, and getting the pelvic floor healthy, restoring blood flow is going to be central to trying to get things better for you.
Okay.
Okay. And also too with Candida. Now listen, with Candida, I had a super drug resistant Candida infection for 2 years from doing an old IC protocol by Dr. Paul Fugasato, which was the old antibiotic theory. And it did nothing for my IC. And what it did give me was a serious drug-resistant Candida glabrata infection. And I was the poster child for yeast for 2 years at my Kaiser. And I even had doctors yelling at me, saying, there's no way you have yeast. You took diflucan. And my answer was, prove it, do a swab. Every time they did a swab, I had yeast. And they were stunned. And they usually came back and apologized. Some didn't, some did. What I found for me was that I had to stop feeding the yeast. Yeast love sugar. They love carbs. And it always flared if I ate ice cream or yogurt. Anything that was a milk sugar made my yeast grow like mad. So the book that helped me was a book called The Yeast Connection. The Yeast Connection in Women I found remarkably helpful. And important for you to know, the Center for Disease Control put Candida as one of the top 10 threats for drug resistancy. And so they're a beast to get rid of. They're an absolute beast to get rid of. But the good news is you've gotten rid of part of it. Now it's just in your mouth where yeast lives happily because it's a nice warm environment. So you got to really cut way back. You got to stop feeding it. So proteins and veg, you got to lose any sugar and any carbs for a while, and you'll starve it to death.
Is like, they gave me this Floromyces. Is that a no-no?
I don't know what it is.
It's a probiotic, they said.
Well, if it's a probiotic that is normally involved in controlling fungus, controlling Candida, then that makes sense.
No, you haven't heard of people I guess I'm scared because I have really low vitamin B12 and I took a pill and it made me flare. So now I'm afraid to take all these supplements. Because then they also told me to take P by Vitalis.
They told you to take what? What?
PEA.
Oh, good. Yeah. Okay. Which we have too as Peora. Right?
Yeah. Do you think that would be beneficial too for me?
Well, it's not going to do anything for the infection, but what it might do is it might reduce some of the pain over time.
Okay.
So
all right. I guess I just don't want to be irritated more.
Listen, in the IC study with PEA, there were no side effects reported. I mean, I take this most nights, and I've never flared from it. So I wouldn't, at least according to the research studies, it's good. But you can go over to the National Library of Medicine and look at a whole bunch of research studies and look at other side effects that they've reported. You have to understand yeast. Have you ever made yeast? Have you made yeast spread before? Have you ever made
it spread?
Have you ever made homemade yeast spread? Okay. So you get the powdered yeast, you put it in a warm cup of coffee, a warm cup of water, and you put a teaspoon of sugar in there, and it immediately starts growing and bubbling. That's what's happening. That's what's happening is you have yeast and it's being fed somehow, and that's why it's growing. And so all I can tell you for me is I didn't eat ice cream for a couple of years or milk or yogurt because I mean, listen, having candida in your bladder is brutal. It is so much worse than I mean, the pain was insane when I had candida in my urinary tract. So it was very easy to give up the ice cream. I would have done anything to not be in that pain.
Can they see that on a regular UA?
No, not at all.
Okay.
A UA only tests for a very small population of bacteria that will feed on the culture they're giving it, but a next generation test will.
Okay.
Okay.
I've never had one of those, so.
Yeah. Yeah. Okay. So your homework is to have a proper pelvic floor assessment, and maybe consider getting the book, The Yeast Connection, or The Yeast Connection in Women. And that's really what it pounds at, is that you have to learn you have to stop feeding the yeast. Otherwise it just goes to town. Okay.
Is there anything that you recommend to take to try to soothe the urgency or the pressure or anything in the meantime?
Well, if it's, if it's from a candida infection in your urinary tract, and nice, normally what they would do, now you said you were on diflucan. If you read the safety warnings that come with diflucan, that white piece of paper, you will find a little tiny paragraph that talks about drug-resistant infections. And it says 1 to 2 pills will not kill some infections. Some infections require daily dosing over a period of time. And that's what ultimately killed they killed my yeast 2 ways. Well, number 1, I stopped feeding it. Number 2, I did diflucan daily for like 10 days.
I've been on it for a month straight.
Yeah, but I took 3 150 pills a day, not 1. They had me doing 3. And it was, but it was so high, it was way above the safety warning. And so they had to test my liver function when they were doing it. And we had to do that like 3 times over 2 years. And then the last thing that happened is we found a population of yeast burrow deep into my vulva. And so we were able to kill the yeast in my bladder, but the yeast on my vulva was reseeding it. And that was my mistake, because I thought diflucan would kill everything. And so I didn't use the nystatin cream they gave me for my vulva. And so using that cream to kill, and I think, now don't quote me on this, I think they have a nystatin mouthwash for people who have oral candida.
I'm taking that well.
Okay. Well, it's a journey, hon. It's a journey. And I'm so sorry. I'm so sorry you're going through that. I did a big article on that, but drug-resistant candida infections are a real threat right now, and they're a beast to get a hold to get control of. So, talk with your doctor.
Have you ever used boric acid?
I did use boric acid. I never found it to be particularly helpful. Are they talking about using boric acid in your mouth?
No, in vaginal suppositories.
I didn't hurt. And clearly your biome is messed up down there if you've got bacterial vaginosis. So if it will help restore that biome, then, or restore the pH so that the bacteria aren't flourishing, I mean, it's certainly a viable thing to do. I wouldn't worry about it. I mean, you just got to try. I don't remember ever having an issue with it myself, but we're all different. So.
Right. Okay. I guess that's my biggest worry now, because I've been having issues for like a month and a half straight, and then having the flare up with the B12 for over a week. I'm just like scared to take anything I haven't now. Well, supplements never used to bother me, but now they do.
Well, one supplement bothered you. A B12 supplement bothered you. That doesn't mean that every supplement will bother you. You are in that, exhaustion, pain, anxiety phase, and and you just kind of have to break yourself out of that. I have what I consider to be a pretty good video on anxiety and IC. I took a class called Phobies, and what it taught me, it was created by a surgeon with anxiety disorder whose son also had anxiety disorder. And he taught me that anxiety is really a bit kind of an overdose of adrenaline. That there's so much adrenaline circulating through your body that it's creating all of it. It's making more, it's messing with your brain chemistry, it's triggering more catastrophizing, et cetera, et cetera. And so what the class taught us was how to reduce adrenaline. If we can reduce the adrenaline load in your bloodstream, it's stunning how much better you feel, right? And so the way they had us do it is every time and remember too, every time you have a negative thought, you give yourself another jolt of adrenaline. You're triggering more fight or flight. And if you're like most people today, especially this year, it's like every day there are legitimate reasons to be upset and scared about things like COVID. And so what they taught us is every time you have a negative thought, visualize a stop sign. Just close your eyes, stop. Then, just for a couple seconds, take a nice, slow, deep breath. In for 3, out for 3. That oxygen renders the adrenaline from that negative thought chemically neutral. It deactivates it. So we have just taken the power, the chemical response away from that. So stop sign, deep breath. And then the third thing is to minimize the thought. You gotta just remind yourself it's a thought. So what I say to myself is, oh my God, Jill, you're not God. You can't predict the future. It's just a thought. It has no power. Get over yourself, right? For all you know, tomorrow could be a fantastic day. For all you know, tomorrow may be the day that your yeast is finally in a decline and it's not giving you symptoms anymore, right? So they taught us the system. Stop sign, deep breath, minimize the thought. Then they sent us home and they said, now listen, this is going to be hard. Because our number one goal is to reduce the adrenaline going through your bloodstream. So every time you have a negative thought, you got to do this. And you're going to do it dozens of times. And they were right. Oh, when I actually paid attention to my brain and what I was thinking, it's like every single thought was scary. You'll never get better. You'll never have children. You'll never have a family. Nobody will love you. All this sort of stuff. You'll never have a career. All this terrible. And so I did it, and I'm not lying. I think I did it 200 times the first day. When I actually paid attention, I was stunned. The next day, I did it about a half as much, about 100 times. The next day, I did it like 50 times. By the end of the week, I was doing it once a day. And you know what? I was calm. I wasn't spinning in a circle anymore. I had gotten the adrenaline under control, and it was stunning how simple it was. And I went through uterine cancer 3 years ago. Not one panic attack. I have not had a single panic attack since I took that class because I do not let my adrenaline levels build. As soon as I catch myself catastrophizing, that's what I do. Stop sign, deep breath, minimize the thought. And so think about trying that, okay?
Yeah, where's that? Where can I find that class again?
It was called Phobies, Phobease, and they don't do it anymore. But you can find old documents on Amazon, like old flyers. But what I loved about the class is that it made it skills based, and they said, "Listen, we're not here to psychoanalyze you." And they basically said, listen, if you had an issue in childhood that's haunting you, yeah, we absolutely want you to get a little bit of help for that. We're here to talk about skills today. What can you use today that will help reduce your anxiety? And then they explained it's all about adrenaline. It's about massive levels of adrenaline, massive levels of fight or flight that are just triggering every single part of your body. They're making your muscles tight. They're making your nerves more sensitive. They're intensifying your pain, because when you have pain that's accompanied by anxiety, your brain will intensify that pain because your brain thinks your life is at stake, even if it's not. So here we were all watching the election results, having no clue, doesn't matter what party you were in, the stress of that absolutely exacerbated pain levels. So, anyway, all I can tell you is with my experience, it worked for me, and it works for me. And now that I'm calmer, and now that I know what to do, it doesn't scare me anymore. IC doesn't scare me. Pain doesn't scare me. I know what to do. I know what to do if I have a flare. I've got the tools. And a big part of that tool is just keeping that anxiety level down. Okay. All right, hon. Well, listen, big giant hug to you. And again, I just want to say to you that you're not peeing blood clots. Okay. There isn't your case is fascinating to me, because I think you're my scoliosis sister. And I think your back pain makes sense. And I think your pelvic floor dysfunction makes sense. The missing piece of this puzzle is, why would you have bacterial vaginosis at the age of 31? And the odds are antibiotic use, whatever. So anyway, just going to plant those seeds. I wish you the best. Please talk to your doctor about what I've said. And remember, I don't give medical advice. I'm just giving context. Okay.
Yep.
Okay, hon. Nice talking with you. All righty. Nicole. Hello, Nicole. Thank you for being so patient.
No problem. How are you?
I am, aside from my, look at my rat. You should have seen it yesterday.
Oh my gosh.
I used a cream. Here that just, I was dark red yesterday. It was like, oh my God, I look like hamburger, but it's much better today. It's just I've touched it and I took a shower. So, okay, how are you feeling today? How is your IC?
So today's an okay day.
Okay.
So I was diagnosed with IC when I was 21.
Okay.
Right before my 21st birthday. So like the worst time, I guess, we told you can't have alcohol. And I'm 28 now. And I've been on and off with how bad my flares were. These past 3 months, I've had the worst flares that I've ever had.
Okay.
Because probably the stress.
Okay.
But my question to you is, my husband and I, we've been married for 2 years, and we are planning on starting a family.
Nice.
And I started the steps already with like my OBGYN, and I started the steps with my pelvic floor specialist and my physical therapist. But I guess my question to you, I have 2 questions. My first question is, do you know of any methods that are natural? Because I have to stop all my pain medication, everything I'm on. So I'm afraid that I'm going to get into a flare when I'm pregnant and not be able to handle that. And I wanted to know if you had any like resources or tools or knowledge that you could give to me on how to do that without medication.
Okay. So we have a pregnancy resource center on our website. And let me just share my screen and let me take you there. So hold on a sec. All right. So now you see a whole bunch of jumbled stuff, right? So hold on a sec. Let me move things. Okay. I cannot minimize a Zoom meeting when I'm, okay. So hold on a sec. Okay. I got it. Hold on. I got to minimize this. I'm always afraid I'm going to turn something off accidentally. That's YouTube. The other one was Facebook. All right, so let's go on over to our website here. So I'm going to icnetwork.org. Oops, if I can type. And if you look under, where is my pregnancy resource center? Where is it? You would think I know where it is. Our website's so big. Hold on, let me just, I think it's, well, here, let's just use the search command. Pregnancy. Here we go, right here. Pregnancy Resource Center for IC patients. There you go. So I want you to know, number one, IC patients have babies all the time. You're going to be a great mom. I'm going to wish you the best for that. I've got Arnold and Melanie's pregnancy planning guide. I think that you should look through that because I think that there will be some tips in there for you. We actually have a book called Ending Pain in Pregnancy by Isa Herrera. If you're having muscle pain, you'll definitely want to get that book. You can get that book on Amazon. And then there has been just one research study that explored different medications commonly used for IC and how that will affect a pregnancy was done by Deborah Erickson at the University of Kentucky. And so you'll see here in 2007, Deborah Erickson made an astounding contribution to the IC community with their journal article, Pregnancy in IC, where they rated common IC medications and their potential risk for commonalities. And you can read through that there. I will say that even though in this study, Elmeron wouldn't touch that with a 10-foot pole, because we have at least believes that her child's eyes were damaged by Elmeron at birth or in utero. They felt that the safest choice was a non-alkalinized lidocaine if you're having bladder issues. Now, non-alkalinizing mean it doesn't have sodium bicarbonate, because sodium bicarbonate helps it get absorbed. And so if you do get into this situation where your bladder wall might be screaming, you might be able to do a simple lidocaine installation as long as it's not alkalinized. And you would never do interstem. Okay, so anyway, and then we got a whole bunch of discussion boards on it where you can read messages from other people. But listen, I want to, before we got to talk about stuff here for a moment. So let me turn off my share screen. Okay. Wait, how do I do that? Look, how do I do this? Hold on. You guys are going to see my screen for the rest of this. Hold on. Where is it? Where is it? I want to turn it off. It's not letting me turn it off. And I can't hear you now. Can you say something?
Okay. Can you hear me?
Yeah, I can hear you. Okay, hold on. I gotta. Come on. There's no.
I can't see your screen though, just so you know.
Oh, you
help.
Oh, none of you could see my screen?
I know I can't. I don't know if anybody else can.
Could anybody else in Zoom see my screen? Oh, okay. Well, then it didn't work in the first place. All right. Okay, just go to our website, Pregnancy Resource Center. There you go. But girl, listen. Your IC began when you were 21 years old.
Mm-hmm.
So what the hell happened when you were 21 years old? Do you have any memory of anything happening?
Okay, so that's when I was diagnosed officially.
Okay.
Is when I was 21. So
Okay.
I was having symptoms since I was 15.
Okay.
And was getting misdiagnosed with like bladder infections, and they would put me on antibiotics, and then the culture would come back and the culture would have no infection. So I was stopping and starting antibiotics like crazy. And everyone just kept saying that I had like a chronic UTI infection. I was trying to find all these different doctors. I've been going to like urologists and specialists and everything forever. And one of the urologists I went to did a cystoscopy on me. Okay. And that's when he realized that, or he's the one who diagnosed me with IC.
Okay, so so wait a second. So were you an athlete as a kid?
Yes.
And what was your sport?
Karate. Yeah.
Okay. Yeah. Okay. So do you have super sensitive skin?
Yes.
Okay. And have you had super sensitive skin your whole life?
Yes.
And so were you ever able to use a bubble bath, or did you have to get rid of the bubble baths? You could never use.
No, I can't take baths like in general.
Okay. Yeah. Okay. Do you have a wicked sense of smell? Can you smell things that other people cannot smell? And do smells drive you crazy?
Not really, no.
Okay, what about your husband? When you kiss him, can you tell him what he's eaten that day?
Yeah.
Okay. Yeah. Okay, so you have central sensitization.
Okay.
Just like I have central sensitization. It is the landscape. Okay. And bear with me for asking this question. What is your ancestry? Yeah. What is your, like I'm Norwegian and Swedish. What is your ancestry?
So I'm Czech and Russian, Indian, like Native American. I don't know what my mom's side is because she's adopted, so I have no idea. So I'm just kind of going based off of my dad's side.
Do you know
I know that his mom was Cherokee.
His mom was Cherokee?
Yeah.
Okay, so we have a research study that shows that Cherokee Indians are far more at risk for IC symptoms.
Oh, really?
Yes. And that study was done at the in Oklahoma. I forget the name of the guy who did it, but I could find that study for you.
Okay.
So the question is why? So let's think about central sensitization for a moment. Our bodies were designed for life thousands of years ago. Okay. Now think about mine for a moment. I'm Norwegian and Swedish, from northern Norway and Sweden. So what were my ancestors eating? The world's blandest diet. They were eating fish, they were eating deer, whatever they could catch and kill. And they might have had berries once a year when they were ripe. I don't know if they had apples, but that's it. And they had salt. There was no coffee, there was no chocolate, there was no pepper, there were no spices, there was no cinnamon, there was no, spicy hot peppers like cayenne. And so if we ponder the concept of evolutionary adaptation for a moment, we know that species adapt over time to stressors. We know that the fastest cheetah will survive because it can catch food. We know that the fastest gazelles will survive because they can outrun the cheetahs, right? So our body is a reflection of what our ancestors were exposed to. And if we think about Native American, if we think about any of the indigenous populations, especially north of the equator, and we think about what their environment was like and what their food structure was like, right? So like I've never been able to eat chocolate. When I eat chocolate, it is like poison in my body. Because my ancestors were never exposed to chocolate except for maybe in the last 800 years. My body does not know what to do with chocolate. It is poison for me. And when I'm exposed to caffeine, I shake like a leaf and I sleep. I cannot sleep for 36 hours or 48 hours. This whole sensitivity thing is freaky. It's like, why? Why am I sensitive? Well, but if we look at it in another way, every tribe needed somebody who was sensitive who could smell the good food versus the bad food, the good water for the bad water. There's a tremendous gift to being sensitive because you and I will smell the fire first and we will be able to save people. The perfect career for you and me, making perfume. Because we have such a wicked sense of taste or smell. My sister is an award-winning winemaker who's won just about every award you can win in California. I mean, we're talking, the highest awards possible. And yet she doesn't swallow much wine because she has a sensitive bladder too, like I do. But why is she so good at winemaking? It's because when she tastes it, she can taste more. There's like a whole nother level of sensation that she has, that I have, that you have, because our nervous system is easier to turn on. That's not a disease. That's the landscape. That is the gift of our ancestors. But it's important to put that in context because that's how you and I are built. It's just is what it is. It's not a disease. We have to, on a daily basis, respect the fact that we have a nervous system that's a little bit easier to turn on. Right? So like,
I did not know that.
Yeah. So you right now are wearing a sweatshirt.
Yes.
Is that cotton polyester with a fleece inside or is it all cotton?
No, it's a fleece inside.
Okay. I can't wear that.
Okay.
My arms go crazy. And if it starts getting the little, as you wash it and it gets hard inside, I am insane.
Yeah.
Like I have to wear cotton. I can, and especially as I'm getting older and now that I've gone through menopause, that sensitivity is just a little bit there. So there are two, number one, you're just sensitive. So you're going to have a more sensitive stomach. You're going to have more sensitive bladder. You're going to have a more sensitive skin. It is what it is. No shame, no blame. It's the gift of your ancestors. But the other giant piece of your puzzle is that you were a cheerleader.
Karate.
Oh, no, I'm sorry. Karate. Okay. Sorry. And you fell a lot, right?
Oh yeah, I was hit a lot.
Okay.
I mean, yeah, it's very physical thing. Yeah.
So the challenge for us with being sensitive is that, yeah, we get injured and our injuries do heal, but we feel them more because our nerves are just more sensitive. But the fact that you did karate tells me that you have to have some pelvic floor muscle trauma. So what did the physical therapist say? If you're working with a physical therapist, what are they saying to you?
So I just had my first appointment last week. I have my second appointment this week, and they didn't, this coming week, they're going to start internally because she said that she worked like on the top of my bladder, I guess, from the outside, because she said there was like a lot of nerve clusters or something that she was working on. It was like my first consultation.
Okay.
So that took longer than she expected. And then this Thursday, actually, I go back and she's going to start like the internal pelvic floor therapy with me.
Good.
He also recommended acupuncture.
Yeah, sure.
Which is something that I actually have like a consultation for next week as well. I'm like really just trying anything to get off of the pills because I don't want
Well, and so be aware with acupuncture that when you're sensitive, it can be a little overwhelming to your nervous system. I did whole body. I could do localized acupuncture, no problem. But when they tried to do my whole body, it was no. It was just wet. It was icky. I didn't like it at all. So don't go, start small with the acupuncture, and you got to tell them that you're a bit more on the sensitive side. Did you tell the physical therapist you did karate?
No.
Okay. That's what you've got to do. That's what you've got to do. And again, for you need this book. It is a master class in your muscles, and it's important. It's not only important now as you're trying to navigate pelvic floor therapy, but when you're pregnant and after you're pregnant, so that you will know what to do. It's important that you understand how your muscles change during pregnancy, because in the United States, we do not send young mothers back to pelvic floor therapy where they need to be. And so, what medicine are you on?
Amitriptyline, baclofen, pyridium, and tramadol. Okay,
so the baclofen is a muscle relaxant. The tramadol calms nerves. The amitriptyline calms nerves. And what was the fourth one? So which one did
pyridium.
The pyridium to numb your bladder wall. Okay.
Yeah.
Well, I think it would be really interesting to try to get in, a good 10 or 11 sessions to try to get your, to just try to get your muscles healthy again. Yeah. Here, hold on a sec. Somebody's, okay. Your case is really, to me, crystal clear.
Okay.
You took numerous pelvic injuries. And honestly, I think that that's where you need to be focusing your time and trying to understand the type of injury you have and what is the best way to address that injury. And it may be that you might need to hold off on the pregnancy 6 months and depending upon what they find, and try to get those muscles calmer and more relaxed.
Okay.
That would be a guess, but it's just a guess, hon. But listen, what I want you to know is I see patients have babies all the time, and you're going to be a great mother. And I absolutely don't want you to think that, let's see, how do I want to say this? And in a Facebook group earlier this week, somebody told a young woman not to have a baby. And it was disgraceful. And I chewed her out. So I just want you to know that tons of women have babies and they're very, very happy. And I absolutely wish the best for you. Carry hope in your heart, and you're going to be a great mom. But we got to figure out what the hell's going on with your pelvis, okay?
All right, thank you so much, and I will take all of your advice. I appreciate your time. Thank you.
You're very welcome, and please keep in touch and let me know how you're doing. And most importantly, after you have your pelvic floor assessment, I would love for you to email me or call me and let me know what they find. Because again, the biggest risk factor is childhood athletics, and I'm telling you, karate is about one of the most traumatic things you can do other than bike riding. So it'll be interesting to see what they find. But muscles heal when they're treated correctly. Okay? Okay, hon.
Thank you so much.
Nice talking with you.
Thank you.
Okay, I think the last person we have is Eileen. Eileen, are you there? Hello, Eileen. And she does not have a mic enabled. All right. So because she does not have a mic enabled, I think we are going to end the Zoom meeting. And I'm going to go back to Facebook and YouTube, and we'll take last questions there. All right. You guys, thank you so much. It was a great session today. I hope I helped. I hope I gave you context and at least a few more leads to pursue. All right. All right, everybody. I'll see you later on Zoom.
Thank you.
All righty. We are going to now go back to Facebook and YouTube. Facebook, we still have 21 people watching. Okay, there you go. Got to get rid of that. And hold on, I just got to set my computer up here. Wow, we've gone a long time today, and now my makeup is pretty much off, and you're seeing the real Jill Osborne. Ah, wrinkles and all. Oh, it's so weird getting older, I'm saying. So Sherry says, is your sister sensitive to taste? Yes. Are wine judges sensitive to taste? Not often. Not often. I mean, you know, it's so interesting. And like we've been talking about, she was here last night for the first time since the fires, right? And they left last night. It was because my dad's 98th birthday, and they, you know, everybody's being very careful, and she hasn't left her home hardly at all. So we were pretty good. But when we opened the door to walk out, she goes, "Does it always smell like that?" And I went, "What do you mean?" She goes, "Well, can't you smell it?" And I went, what are you talking about? She goes, "Well, it's not." Anyway, what it was is it's the ash from the fires. The hillsides are still covered with ash. I mean, we still have ash out in our yard. And so what's so weird is that normally in the fall, you get this wonderful kind of, you know, when it's cooling off, and it's kind of like a forest smell, and it's wonderful and it's peaceful. And it's when you get to snuggle, you know, with an Afghan in front of a fire. Only for us, there's like this whole nother layer that's kind of a peppery, ashy smell. And she was really surprised. And it's like, yep, that's what it is. It's weird. All right, guys, I will take, Facebook. I wasn't sharing my screen, and I can't easily switch off and on. If I were only on Facebook or only on YouTube, I could share my screen with my streaming software. But since I'm simulcasting on both, and I can only have my streaming software on one platform, I can't share my screen normally when I do this. Although I am starting to drop into Facebook once a week and doing a session just on Facebook again, like I used to, now that things are calming down. All right, guys, last call for phone number. Last call for questions. Last call for questions. Aaron says, any suggestion for urgency during a flare? I drink a ton of water to flush my bladder, but anything that I can do for urgency? You can try pyridium. Pyridium would numb the nerves in your bladder wall. And so it would be interesting to see if that helped. You could try alkalinizing your urine. I mean, you could do the whole bladder wall rescue plan that you can find on our website and see if that would help. But sometimes urgency is caused by tight muscles too. So we want to try to relax your muscles also. Lindsay said, my IC was better when I was pregnant. I have 4 little ones. I wish I could make my body stay pregnant all the time. Lindsay, you're so right. I mean, it's amazing how many patients that happens to. One of my dear friends from when I started my first support group had she was probably the most severe patient in our support group, and she occasionally drops into these meetings, and symptom-free when she was pregnant, absolutely symptom-free, which tells us that there is a very clear hormone subtype, and that's a subtype that has not been defined well. But that definitely happens to a small group of patients. Kelly, thank you. She says, I'm so happy I found this group. I'm desperate for healing. Kelly, I'd love to help you if I can. I'd like to recommend a product called the Happy Bladder, an Australian product. Very good. Don't know anything about it. Depends upon what's in it. Hello, Susan from Canada on YouTube. Thank you for coming in. We're just about at the end of the meeting. Jennifer says, I have IC flares. Thought I had one this past week. Unfortunately, it was a severe UTI. I just got out of the hospital. Girl, I am so sorry to hear that. How can I figure out if I'm having an IC flare or UTI? Well, so number one, you have to, so there are some very clear symptom differences. With a UTI, number one, you could have fever. UTIs are really known for causing a lot of urethral burning that typical flares usually don't cause unless you have estrogen atrophy. You could do a azo test strip. Where is mine? So this would be kind of your first defense. It's wildly inaccurate at times. There can be false positives and false negatives. But a simple dipstick test would at least tell us if you've got positive leukocytes and positive nitrites. If you are positive for nitrites, you have infection because nitrites are only made by bacteria. But if you're positive just for leukocytes, it's probably just an irritated bladder wall and or flare. But you can always ask a doctor for a culture, or more importantly, request a next generation urine test. Kathy says, and also, bladder infections can cause a lot of bladder spasms, where, the last bladder infection I had, what drove me to because again, I thought it was a flare for 6 weeks, but what drove me to the end was that as the last couple of drops of urine were coming out of my urethra, I had this violent spasm that like shot up my spine, and I would just go like this, and I was like this on the toilet for like 5 minutes until the spasm went away. And when I went to my urologist and talked to the nurse, she goes, Jill, don't you know you're having bladder spasms? And I went, no, I've never had these before. These are scary. And they give you, and they did the culture, and they found I had a pretty bad infection. And they also gave me an antispasmodic, a ditropan, to stop those spasms. And they stopped the spasms within 20 minutes. So Kathy says, I spoke to you in the past about the doctor telling me that my bladder needed to come out because it only held 50 cc's and would only hold 2 tablespoons of water. Well, I saw another doctor last Thursday who performed a cystoscopy with Botox and checked my ureter to see why my urine keeps backing up into my right kidney. He said my bladder was completely normal in size and mucosa. What the? Holy crap, Kathy. You could have had an entirely normal bladder removed. What the? So either number one, the first doctor was terribly wrong, or number two, whatever you were doing has healed your bladder. Wow. Yeah, healing always happens, girl. Your bladder's wired to heal. Your whole body's wired to heal. It's not like healing turns off. Usually for IC, we just get in the way of healing by pouring acid in our bladder if we have a bladder injury. But I'm so freaking happy for you. Holy moly, you must feel fantastic. It'd be really interesting to do an article on you and think about what did you do before and after. Did you massively change your diet, whatever? Well, boy, you found the magic key for you, because your bladder has healed, and I am so happy for you. That is incredible. Christy says, I've been having bladder instillations for the past 3 weeks. I'm not sure if they are helping at all. They have caused some big flares. Should I continue? They're heparin instillations. Well, treatments are supposed to improve your quality of life. And so if you feel better when you're doing it, then that's a good sign. If you feel worse afterwards and you're getting progressively worse and or it's minimizing the quality of your life, maybe it's time to move on to something else. I would have a, normally here, hold on a sec. I gotta, let me, the light is a little too, wait. All right, there you go. The big secret would have been to do avoiding diarrhea. A lot of patients, they just do treatments and they don't measure their symptoms. And a lot of times what you'll find is treatments are improving your frequency, urgency, although you still might have pain. But if your frequency, urgency was improving slowly but steadily, you're getting up fewer at night, you're having less pain, then what that would tell us is that the bladder installations are helping you and that eventually you might get to the point where it will help reduce some of the pain. But if it's causing big flares, the other thing is you could be reacting to the lidocaine. Christy, there are some patients who are intolerant to lidocaine, and lidocaine heparin installation will actually send them into a bad flare. And generally what they will do is swap out the lidocaine for maybe Marcaine. Lidocaine is a short-acting anesthetic. Marcaine is kind of a long-acting anesthetic. So, and sometimes too, the formula might be funky. If they're putting DMSO in there with it, the DMSO might be causing more irritation. If they are putting something else in it, if they're using a salt solution rather than DI water, that might explain why it might be irritating you a little bit more. So there you go. You got to talk to your doctor and really think logically about your symptoms. Maria said, azo test strips are always positive leukocytes and negative nitrites. Let me explain why, hun. I want to explain that so you understand that. All right, where's my postcard? See, everything fell on the floor, so let me just get a different postcard. So let's just say that symptoms are because of estrogen atrophy. Okay, so let's just pretend. I can't tell from your picture how old you are, but or let's say that you had a chemical injury to your bladder wall, right? Okay, so here you go. Because the bladder, like any other part of the body, can be hurt. And when it's hurt, this outer mucosal barrier is broken, and this allows irritants in your urine to reach the more tender, fragile cells of your urothelium, right? And that the purpose, your bladder is like your mouth. It is a hollow organ coating of mucus. Your bladder is a mucous membrane organ, just like urethra is. And that mucus has a purpose. It is protective. It acts as a barrier. If your mucus is damaged or you've lost it because of estrogen, substances in your urine get to this layer. Now, what's interesting is on all the new research studies, what they're finding is these aren't like passive cells. They communicate. They have a lot of different responses to foreign invaders. And basically, let's just say acid gets in here and these cells go, uh-oh, there's a problem. And they trigger the immune system to bring your body's fighters to the area. And so what happens is up through your blood vessels come white blood cells, leukocytes. And the white blood cells swarm into the area to kill the defender. I mean, to defend you, to kill the intruder and to be your defense mechanism. But the fascinating question is, how does the white blood cell get from the blood vessel up to here? And the answer is that the capillaries open and release them. So the capillaries actually open up and let them out. And when they let out white blood cells, they also let out red blood cells. And that is why we often have microscopic blood in our urine, is because Your body is just your body has released white blood cells in the area, and that's released some red blood cells to the area. But that can happen from acid irritation. That doesn't necessarily mean that there's active infection. And so generally a positive leukocyte means your bladder's irritated. A positive nitrite means that you've got infection. And if you have both, yeah, then you definitely need to have more tests to determine if there really is infection. Lisa says, can IC cause vulvar itching? I have had no yeast infection. You have suspecting hormone. Okay, so Lisa, we used to call vulvodynia IC on the outside. IC on the outside. And it can be caused by a couple of different ways. Number one, again, it's a mucous membrane organ. And so this applies to the vulva just as much as it applies to the bladder wall. When you're dry, chemicals are going to irritate you. Urine is going to irritate you. So one of the early symptoms of genitourinary syndrome of menopause is going to be feeling when you're urinating, it burns. That as urine is crossing your vulva, it's uncomfortable. It feels hot. We call it urine burn. That is a classic symptom of estrogen atrophy. And if you give that skin estrogen, it will start to produce mucus again. I mean, estrogen is remarkably, the skin is remarkably responsive to estrogen. I mean, you can see the slides of the skin thickening, bulking up, and improving. But the other thing that we want to look for is muscle tension. That if you have super, super, super tight muscles, and I dropped my vulva here, hold on. Where did it go? Okay, so let's look at this for a moment here. So here we have your pelvis, right? So here's your hip. Looking at it from the top down, you can all see some of your pelvic floor muscles, and it's kind of like a three-sided box open in the front, right? And there are 3 layers. So you've got shallow muscles, medium muscles, and deeper muscles. And obviously you can see the deeper muscles right here, piriformis muscle and stuff like that. So let's put the shallow muscles on. All right, so here's your shallow muscles. These are your levator ani muscles. And what makes these muscles so incredibly important is that they're the only muscle group in the human body that control bodily functions. Because there's, for a woman, 3 holes in it. There's a hole for your urethra, a hole for your vagina, and a hole for your rectum. And so as you can imagine, and this muscle, remember, goes from front to back. It starts at your pubic bone, it goes along the base of your pelvis to your tailbone. If these muscles are tight, it's going to make it hard for you to pee, right? You're not going to be able to start your urine stream right away. You're going to wait 5, 10, 15, 20, 30 seconds before you can pee. If they're tight by rectum, you're going to have trouble having a bowel movement. And that's what I struggle with more. I struggle more with these muscles right here that really kind of mess with it. But on your vulva, if you've got tight pelvic floor muscles, they're also potentially reducing blood flow to your vulva and also triggering nerves. So, Lisa, I had something really interesting happen last year. I had vulvodynia in my 20s. It's been gone for decades, right? I mean, really just rare that it's ever happened to me. And last time I had it was 30 years ago, until last year. And I started getting pinpricks along my pubic hairline. First on one side and then on the other side. It was like somebody was stabbing me with a needle. It's like, well, what is this? So weird. And then over time, over a week, it spread from front to back. And then by the end of the week, it was the entire vulva on both sides. And every now and then, it'd just be a pinprick here and a pinprick there and a pinprick here and a pinprick there. And I go to urgent care. I go to the urgent appointment at my gynecologist to see this really old doctor. I mean, he's like 75 years old. He does this massive scrape to look for yeast. And he goes, wow, you're red. And it's like, yeah, I know I'm red. I'm messed up down there. And they put me on, he thought it was yeast, and he put me on diflucan for, 10 days, and Monistat and stuff like that. Didn't touch it. Then my regular gynecologist did a punch biopsy, and she goes, Jill, I think you have eczema. So she then gave me hormones. No, she didn't give me hormones. She gave me steroids for about 6 weeks. Didn't touch it. And so by that time, I asked to speak with our pelvic pain specialist at my local Kaiser. And she goes, we're talking on the phone. She goes, can you wear pants? And I went, no, it kind of hurts. She goes, you have vulvodynia. I'm like, okay, I get that. I've had that before. And she goes, no, but what you don't understand is you've got a nerve entrapment. And she was right. She sent me to physical therapy. These muscles were super tight, and they were squeezing the nerve that was causing my vulvodynia. And so pelvic floor physical therapy stopped it, along with, she gave me a compounded estrogen lidocaine jelly to use. And so understand that vulvodynia can also be the result of tight muscles squeezing nerves. Okay? Kathy says, this has been the worst year of my life, severe depression, weight loss. You started on Bladder Builder along with aloe vera, and you have a typo there. I'm in shock. I'm really pissed at the first doctor. So it sounds like it's helping you? Kathy, is it helping you? Bladder Builder. Okay, wait. Okay, I have to scroll up here. Oh, look. Jill, I spoke to you in the past about the doctor telling me that my bladder needed to come out. Okay, yeah, that's you. Now your bladder is completely normal. Oh my God, and it was because of Bladder Builder and aloe. I'm sorry, I totally missed that. I'm so happy for you. So Bladder Builder has PEA in it, which calms nerves down. And the aloe can be very calming and soothing to those tissues. So yeah, baby, woohoo! Awesome news. We saved a woman from having her bladder removed, and her bladder is now completely healthy using Bladder Builder and aloe vera. Girl, that is so exciting. I'm so happy for you. Can Candida cause positive leukocytes? Sure, because Candida is burrowed into the cells, and it's an invader in the cells, and your body's going to send leukocytes there to fight it. So absolutely, Candida would cause positive leukocyte. I don't think it's going to cause positive nitrates, though. Maria says, Alka-Seltzer removes pain completely for 1 day, because the Alka-Seltzer is alkalinizing your urine. So that tells us that your bladder wall is definitely the source of your distress. How do you test for estrogen atrophy? There's no test. It's just eyeballs looking at your vulva. Estrogen atrophy is very easy to see on the skin, and you just need a good doctor to look at it. I don't know how old you are. I can't tell. Oh wait, you're 31. So we would look. So normally at your age, we wouldn't see age-related estrogen atrophy, but it could relate to birth control if you're using a birth control method, or there might be, there might be something else going on too that's manipulating your hormones a little bit. So they just need to look at your skin. Apparently, skin that's extremely dry from estrogen atrophy has lines in it. I've never seen it myself. I've used a mirror. I haven't seen it, but doctors have been very clear in seeing that. So, well, listen, guys, we've been going on for 4 hours and 12 minutes. I think it's time to call it here. So I tell you what, so we did a giveaway earlier, 2 bottles of the new supplement, Cystomend. And I tell you what, if you guys, the next 2 people to email me your mailing address, I will send you something. I don't know what, but I will send you something. as a gift. It might be a bottle of Cystomed, it might be some pre-leaf, it might be some tea, some herbal tea. I don't know, but I will come up with something for you. So if you would like a free giveaway from the IC Network, send me an email, icnetwork@mac.com. That's short for Macintosh computer, icnetwork@mac.com. And I'll do another round of freebies. All right. Okay, my friends. I will see you later. Carry hope in your heart. Practice your deep breathing. Control the anxiety. And let's work on stuff. Okay. I'll talk to you later. Goodbye, Facebook. All right, YouTube. I will see you guys later. Have a good one.